Good evening and welcome back to Chatushtaya 2023, a national seminar with paper and poster presentation. And I welcome everyone to the final day of paper and poster presentation presented by team Rakta. And first of all, I invite our respected panel members. We welcome you all. And now we can start. And before that, dear participants, the presentation will be live on YouTube channel and the copy will be saved. So please don't unmute yourself unnecessarily. And now we can start with the paper presentation. And for that, I invite Dr. Rahul Sharma.
Good evening, everyone. My presentation is about Rakta Stambhana Upayas in Shalya Vyadhis under the guidance of Dr. Shivshankar, Professor of Shalya Tantra, PG Studies. Today's contents are Introduction, Rakta Stambhana Nirukti, Rakta Stambhana Upayas, Rakta Stambhana Upayas in Shalya Vyadhis, discussion and conclusion. So we'll start with introduction. Rakta is important constituent as it's considered as the Jivana. It has a potential for Prana Dharana. Atyadik Rakta Shrava can lead to that, hence Rakta Stambhana Upaya should be adopted. Nirukti, the word Rakta means body constituents which is red in color. It is considered as Jivana as mentioned in Ashtanga Hridaya Sutrasthana 11th chapter 4th shloka. According to Acharya Charaka, Sutrasthana 22nd chapter 11th shloka, the word Stambhana means to stop or block. Rakta Stambhana means to stop excess flow of the fluid. Rudera is Mula for Deha. Sharira is supported and maintained by Rakta. So it should be protected by all effort as Rakta is the Jivana. Rakta Stambhana Upayas is described in Sushruta Sutra 14 chapter 39 shloka. Rakta Stambhana Upayas are Sandhana, Skandana, Pachana, Dahana. Rakta Stambhana Upayas from Sandhana Karma. Sandhana should be done with Kashaya Dravyas. Skandana should be done with Raktashaya, Stanikaranam, Skandanam with Shita Dravyas. Pachana should be done with silk cloth or Kshara. Dahana Karma can be done with Sankocha of the vessel. According to the Sushruta Sutra Sthana 14 chapter 41 shloka and 42 shloka, Shitopchara, Ritikadi or Panchavalkaladi, Churna, Pachana with Bhasma, Dahana can be done with using Shalaka if none of the above the treatment is working out. Treatment for Rakta Ati Pravritti, Bhaya Chikitsa, Abhyantara Chikitsa and Bhojana. As mentioned in Sushruta Sutra 14 chapter 36 shloka, Pranamukha Avchurna, Anguliarini of Pidana, Gada Bandha, Achadana, Lepa, Parisheka, Shara and Agni Karma all helps in Rakta Stambhana. Abhyantara Chikitsa, Kakyola Kwata and Rudira Pana like Ena, Kuramba, Shasha and Mahisha Vara. These are the animals where Rudira Pana from which Rudira Pana can be done. It is mentioned in Sushruta Sutra 14 chapter 36 shloka. Bhojana, Yusha, Mamsarasa, Shira Bhojana. It is described in Sushruta Sutra 14 chapter 36 shloka. Rakta Stambhana Upaya in Shalya Vyadhis we'll discuss now. Agantuja Varna, in Banna Varna, there will be Rakta Pravritti from Guda, Marga, Mutra Marga and Nasha Marga. In Binna Koshta, when there is Ati Rakta Shrava, Ashrika Pana is indicated to prevent Upadravas. It is mentioned in Sushruta Chikita Sthana, 2nd chapter, 45th shloka. In Bhinna Vrana, Rakta Pravritti from Guda Marga, then Vidari Adi Gandha Kashaya is used as a Gruta. Madhu should be administered as Astapana Basti. Same drugs can be administered with Grita, Shira and boiled, and it is used as Anuvasana Basti. Priyangu, Rodra, Anjana, Gairika, Utpala, Dravyas, all are in equal parts, can be used as Kalka and can be mixed with Grita and Shita Jala, administered as Niruha Basti. After giving Shira Bhojana, Anuvasana Basti given with Yasti Madhu, Siddha Gruta can be done. If bleeding stops and the person has gained Bala, the Vamana can be advised. Chinna Varna, for Chinna Varna, we can do Shivana Karma and Gada Bandha should be done. Agni Karma is done with Ushna Taila. Taila prepared from Chandana, Padmaka, Lodra, Utpala, Priyangu, Madhuka, Aridra along with the Shira can be used for Ropana for Chinnavarnas. Shira Marma with the Lakshana. When Shira is injured, there will be bleeding from the wound. The blood will responsible to Indragopa, resemble to the Indragopa. These all are mentioned in Sushruta Sutra 25th chapter 35 shloka. Treatment for Shira Marma with the Lakshanas are Agni Karma using Sneha can be done. Atishrava, Niruddha Karma should be adopted. After Shira Veda Karma, if there is Atishrava, then Churna of the Rodra, Madhu, Priyangu, Patanga, Gairika, Sarjarasa, Rasanjana, Shalmali, Pushpa, Shanka, Shunti, etc. can be used. It should be pressed with the tip of the fingers to the wound. It will stop the Rakta Shrava. Powder of the bark, Shala, Arjuna, Irimeda, Meshashrungi, Dhava, Dhavana, ash of Kaushema, or powder of Samudra Fena, Lakshana can be sprinkled over the Vrana. After Jaloka of Charna, if Ati Rakta Shrava is there, then Parisheka with Shita Jala or Kashaya can be done. Pradaya with Madhura, Madhura Snigdha Sita Dravya should be done. Dalana mentioned in Atiyoga of the Jaloka of Charna, Sheka with Sita Jala and Bandhana with Vastra is done to stop the bleeding. In Gudam Gata Raktaja Ashas, if Rakta Ati Pravritti is there, immediately Chikitsa should be administered. Commonly used Samana Yogas for Ati Rakta Pravritti are Ushirashava, Vasha Kashaya, Vasa Swarasa, Vasa Gruta, Ashoka Arishta, Shatavari Gruta. Sandhana, Skandana, Pachana can be done in minor cuts, Shatajavarna, Vidyavarna, Vinnavarna. Skandana is done wound which is more than half inch which is caused due to injury. Pachana can be done in Dushtavarnas which is non-healing, more than 21 days. Dahana can be done in Kadara, ward or in surgical cases. It is the Rakta Shrava is compared to hemorrhage. Source of hemorrhage, external hemorrhage, internal hemorrhage. As we can see in the picture, external, internal hemorrhage. Hemorrhage may be arterial, venous, and capillary. Time of appearance of hemorrhage. Primary hemorrhage occurs at the time of injury or operation. Reactionary hemorrhage occurs within 24 hours of injury or operation. In most of the cases, within 4 to 6 hours. Cause can be dislodgement of the clot, slipping of the ligature, coughing, and vomiting. Secondary hemorrhage occurs, which occurs after 7 to 14 days of injury or operation due to infection or sloughing of the part of the arterial wall. Treatment of the hemorrhage to stop the blood loss. Restore the blood volume by blood transfusion, infusion of crystallized solution, plasma or plasma substance. The blood loss is mainly stopped mainly by 3 methods: rest, pressure, and by operative methods. Control of bleeding in external wounds. There are 4 methods: direct pressure, elevation, indirect pressure, use of tourniquets. Direct pressure, apply firm pressure to the wound with gloved hands and gauze bandage. Hold pressure until the bleeding is controlled. Never remove bandages even when bleeding is controlled. When controlled, check the pulse distal to the wound. Elevation, elevate injured extremity above level of the heart while applying direct pressure. And do not elevate if the musculoskeletal injury is suspected. Pressure dressing, place several gauze pads or wounds in case we are suspecting the hemorrhage. Hold dressing in place with self-adhering roller bandage above and below wound site. Create enough pressure to control bleeding. Indirect pressures. In case of severe bleeding, when direct pressure and elevation are not controlled, the bleeding and indirect pressure must be used. Bleeding from an artery can be controlled by applying pressure. Pressure points are the areas of the body where the blood flow can be controlled by pressure by pressing the artery against the underlying bone. Pressure is applied with the fingers, thumb or palm of the hand. These are as shown in the picture. These are the pressure points of the body of the upper extremity. These are the different body parts, pressure points where we can press and control the bleeding. Other methods to stop the bleeding are splinting or cold application. Pneumatic anti-shock garments can be used. These are the modern methods of preventing blood loss. As shown in the picture, these pneumatic anti-shock garments are weared, and the pressure from the foot pump, the air supply is passed, and it acts like as a compression bandage. Internal bleeding causes trauma, clotting disorder, rupture of the blood vessel, fractures, and the hypovolemia due to which causes shock and death. Clinical features: initially rapid pulse, breathing, sweating, pale, cold, clammy skin, lip, and nail beds. As shock develops, gray cyanosis, especially inside the lip, and weakness and dizziness can be seen. Measurement of the blood loss: weighing the swab before and after the use for HB can be done to measure. Treatment: blood transfusion if the hemoglobin is less than 8 gram percentage. Wound: ligation of the small vessels and suturing can be done. For venous hemorrhage, ligation, pressure, and bandaging can be done. Techniques for maintaining hemostasis in surgery. Mechanical techniques are direct pressure, sutures, staples, ligating clips, fabric pads, gauze, sponge, and bone wax. Thermal techniques are electrocautery, hemostatic, scalpel, or laser. Chemical techniques can be used pharmacotherapies like hypotensive anesthesia, epinephrine, vitamin K, protamine, desmopressin, and tranexamic acid. Topical hemostasis: gelatin sponge, oxidized cellulose, collagen sponge, microfibrillaire collagen, tropical thrombin, gelatin, matrix can be used. And tropical sealant and adhesives can be used like fibrin sealants and synthetic glue. Tourniquets are also a good method to stop the bleeding. Tourniquets are often used to operate operation theater for control of hemorrhage in the limbs. Indication are reduction of fracture, repair of tendons, repair of nerves when a blood loss field is described in surgeries. Its contraindication is in peripheral vascular disease. Types: pneumatic cuff with pressure gauze and rubber bandages. Precautions: it should not be too loose or too tight, and should not be applied for too long. Which can cause complications like ischemia, gangrene, and tourniquet nerve palsy. Open injuries are caused by penetrating wounds, protruding organs. First aid intervention should be used: A, B, C, D, which is airway, breathing, circulation. Treat the cause. We should go for treat the cause, dressing, and treat the shock. So discussion: Rakta is important constituent for Jivana. Loss of Adhika Rakta caused due to various conditions should be controlled as quickly as possible. So in our classics, there is mention of Rakta Stambhana Upayas. The 4 Upayas are Sandhana, Skandana, Pachana, Dahana. Treatment of Rakta Atipravritti also includes Bhaya, Abhyantara, and Ahara. Bhaya Chikitsa like Gandha, Vanda, Lepa, Shara, and Agni Karma, etc. can be indicated. Importance is also given for Ahara when Shita Pradhana Ahara and Shira Bhojana have been mentioned in the Samhitas. In different type of Agantuja Varna, as there is Rakta Shrava, Rakta Stambhana Karma have been explained. In Adobhaga, Rakta Atipravritti, Anuvasana, and Niruvabhasti can be given. In Mutrashaya, Rakta Pravritti, Uttarabhasti is used for Stambhana. In Nasa Marga, Rakta Atipravritti, Rakta Pitta Chikitsa is adopted. In Sashti Upakarmas, different Shonita, Tapna Vidhi have been mentioned, whereas Shara, Agni, Sivana Karma mentioned. Control of bleeding in different hemorrhagic conditions should be done based on structure involved like arteries, venous, capillaries, and the stage of hemorrhage. Emergency management of bleeding by tying a tourniquet as a temporary measure for control of hemorrhage. Surgical procedures to control internal bleeding like sclerotherapy, electrocoagulation, laser coagulation, hemoclip application, and can be applied in various hemorrhagic conditions. Bleeding in abdominal viscera can be managed by suturing in simple laceration and ligating the bleeding vessel. In case of massive injuries, removal of injured organ is the best way. Conclusion: Rakta Stambhana Upayas mentioned by our acharyas like Sitopcharya, Gardabandha, Agni Karma are similar to those hemostatic measures used nowadays. Our acharyas had a keen observation regarding the complication of Rakta Ati Shrava and method of Rakta Stambhana mentioned in Samhitas are equally important when compared to hemostatic measure used now. With advancement of the medicine, new inventions has been made in in the form of topical hemostatic substances, which are comparatively cheap and easy to use. During certain situations, it will be difficult to decide whether the bleeding is arterial or venous. The most important thing is to remember that all bleeding must be controlled as soon as possible. Thank you.
Thank you, Dr. Rahul.
Next, I invite Dr. Mohana
Your
for
maximum
the
time
PEPS
limit
presentation.
for the presentation is 8 minutes. Please do follow the time duration. And now I invite Dr. Mohana.
Hello, good evening, everyone.
Good evening, doctor.
അച്ഛാ സീനി ചേച്ചിയുടെ അച്ഛനാണെന്ന് വിളിച്ചത്.
Hello. Hello, doctor.
Sir.
Please share the screen, doctor.
Yes, sir. Sir, I think it's not sharing, sir. I think.
Okay, doctor, I will share for you, doctor.
Yes, sir.
Doctor, please start the session, doctor.
Sorry, sir. My topic is Chakshushya Dravyas.
Please start, doctor.
Yes, sir. Shall I start, sir?
Yes, doctor, please start the session.
Thank you, sir. Good evening, everyone. My topic is analysis of Chakshushya Dravyas. The contents are introduction, Chakshushya versus Rasayana, Chakshushya Dravyas and Achakshushya Dravyas, mode of action, discussion and conclusion. So as we know, Sarvendriyanam Nayanam Pradhanam. According to the recent statistics, worldwide there are 314 million people with visual impairment. The major eye diseases that causes blindness are refractive errors, age-related macular degeneration, glaucoma, cataract. The present era is also witnessing new disorders like corneal epithelium erosion syndrome, dry eye syndrome, smartphone syndrome, and along with changing pattern of existing disorders. Therefore, regular consumption of Chakshushya Varga Dravyas prevent or they slow down the manifestation of various ocular disorders. So we'll know what is Chakshushya. Chakshushya hitam Chakshusyam, that's which is good for Chakshu is called as Chakshushya. And we have a reference from Bhava Prakasha, as it says, the drugs which are Chakshushya and Indriya Balaprada can be advocated as Rasayana, that which arrest the progression of already existing disease and prevent occurrence of new disease. And we'll see what are the Chakshushya Dravyas mentioned by Rajanigantu. According to Rajanigantu, they are Karpara, Raktachandana, Kasturi, Lavanga and Prapondarika. And according to Angasena, they are Triphala, Gruta, Madhu, Yava, Shatavar and Mudra. And these are the drugs mentioned by Yoga Ratnakara. And according to Acharya Sushruta and Vagbhata, the Triphala, Ghrita, Kshira, Dadima, Draksha, Amalaki, Shatavari, Shigru, Yava, Patola, and Karavillaka. And these are the drugs mentioned by Rasaratna Samuchaya. And now we'll see about the Triphala. It is mentioned as Chakshushya by Chakradatta, Sushruta, and Bhavaprakasha. And the chemical constituents are gallic acid, vitamin C, tannins, and flavonoids. It acts as antioxidant, anti-inflammatory, anti-diabetic, and immune modulator. And Triphala is a drug that is present in most of the ocular formulations. And as we know, daily eye wash with Triphala Kashaya keeps one's eye healthy. And a study showed that Triphala, when administered topically, reduces the inflammation. Now we'll see about Rakta Chandana. It's mentioned as Chakshushya by Chakradatta and Bhava Prakasha. And the mode of action is hemostatic, indicated in Rakta, Pitta, and Vataja Vyadhis. It can be applied as lepa in hemorrhagic disorders. And it's one of the ingredient of Mahavasakadik Vata and Pundarikadi Seka, which are indicated for Sarvaneta Rogas. And we'll see about Padabhyanga. Padabhyanga helps in Drishti Prasadana. It's advised that once in 3 days, Padabhyanga should be done. Like regular Padabhyanga nourishes the eye and elevates Vata dosha, and which is beneficial in neurological eye disorders. The literary research of substances indicated to possess Chakshushya action reveals a total of 105 single herbal drugs, 36 single mineral drugs, and 97 ahariya dravyas. Chakshusha dravya based on rasa. Generally, it is Katu, Lavana, and Amla rasas are considered as Achakshusha. Madhura, Tikta, and Kashaya are considered as Chakshusha. Now we'll see about the Achakshusha dravyas. Why this Jivanti, Guduchi, Tanduliyaka are considered as exceptionally best one. Among Aushadha dravyas, Rajika and this Kusumba Taila and Sarshapa Taila are considered as Achakshusha dravyas. We'll see the mode of action of Chakshusha dravyas. It acts as immunomodulator and presence of glutamine and ascorbate does anti-aging action. Now we'll see the discussion as it's told by Acharya Charaka, Chakshustejo Mayam Tasya Visheshas Shleshmato Bhayam. Chakshu is the chief site for Alochaka Pitta, but special protection is required against the kapha. So Chakshusha Dravya should be Kafashamaka and Pitta Vardaka. But Pitta is Adanakara and it will cause Chakshu Indriya Balahara. So Chakshusha Dravya should be having the property of balancing all the 3 doshas, especially keeping the Pitta Kapha Samya, that is Kafashamaka, but without disturbing the Pitta Samyata. Chakshusha drug pharmacologically, it can be categorized under Netra Dahara, Netra Rujahara, Netra Shotahara, Netra Drudikarana, Netra Kanduhara, and Branaropana. So the Chakshusha dravyas mentioned in our classics are rich sources of macro and micronutrients like sorbitol, glucose, fructose, etc., vitamin E, vitamin C. So thus helping in maintaining normal functioning of structural integrity of the eye. Practicing or intake of Chakshusha and Rasayana helps to prevent eye disorders, which can be prophylactic in many highly prevalent lifestyle disorders, in turn, which causes pathological changes in the eyes. Thank you.
Thank you,
Thank you,
doctor.
doctor.
Thank you, sir.
Next, I invite Dr. Manushree for the paper presentation. Dr. Manushree, are you there?
Yes, sir.
Okay,
Sir,
doctor, please share the screen, doctor.
Sir, you only share the screens for me. It is not available in my mobile.
Okay, doctor, I will share for you. Just a moment, doctor.
Okay.
Dr. Manushree, please start the session, doctor.
Yes, sir. Myself, Dr. Manushree, second year PG scholar, Department of Shalya, JMC, Bengaluru. The topic of today's presentation is concept of Mukha Swasthya with special reference to Kavala and Gandusha. Next slide. Ayurveda is a science of life which gives more importance for preventive aspects of disease and promoting the health in healthy individuals. As Mukha is one of the main of Navarandras, it is a beginning of important GI system and is exposed to many risk factors in day-to-day life and habits like tobacco chewing, smoking, alcohol have increased the incidence of diseases pertaining to oral cavity. About 20% of the world population is suffering from oral cavity diseases. In modern life, however, due to the lack of time and negligence, oral hygiene is not properly maintained. Next slide. Mukha Swasthya is essential to remain healthy because many of the infections start from the Mukha only. There are some Upayas mentioned in Ayurveda for maintaining the oral hygiene are Dantadavana, Jivha Nirlekana, Nasya, Kavala, Gandusha, Pratisarana, etc. Gandusha helps in prevention of Mukha Daurgandhya, Asya Vairasya, Dantamala, Dantamalinata, and Aruchi. Diseases of neck, head, ear, mouth, eyes, and excessive salivation, that is kapha praseka. Diseases of throat, kantarogas, dryness of mouth, nausea, stupor, anorexia, rhinitis are especially cured by Kavala. Next slide. Ayurveda gives significant importance to Mukha Swasthya by advising to follow dinacharyas, that is daily regimens like Dantadhavana, Jivha Nirlekana, Kavala, Gandusha consistently. Shastras elaborated special sthanika upramas like Kavala, Gandusha, Pratisarana, Lepa, Dhumapana, Rakta Mokshana, etc. therapies for maintaining oral hygiene. World Oral Health Day is launched by FDI World Dental Federation with purpose to empower the people with knowledge and tools and also confidence to secure the good oral health. It is observed on every year, March 20th. Coming to the common indications of Kavala and Gandusha, this Kavala and Gandusha can be advised in these following conditions: Manya Stamba, Shirashula, Karnashula, Mukaroga, Netraroga, Raseka, Kantaroga, Hillasa, Mukashosha, Tandra, Aruchi, and also Pinasa. There are some disease specific yogas for these conditions. I will explain in the next coming slides. Coming to Kavala, Sancharitam Shakyate Mukhe Purne Sati Sa Kavala Uchyate. Kavala is a procedure in which either medicated fluid or the paste of the drugs is filled in the mouth in a dosage such that it can be freely moved within the mouth. Coming to the Matra of Dravya for Pravara, Madhyama, and Avara type of Kavala would be 1/2 and 1/4 of Karsha. That is, for Pravara type, 1 Karsha of Kalka or liquid. For Madhyama, 1/2 Karsha, and for Avara, 1/4 of the Karsha can be used. Some disease specific yogas for Kavala. In Shitada and Dantaveshta, Bakula Kalka, Jatipalaba Kalka can be used for Kavala. Then in Dantashula, Irimedadi Taila and Lakshadi Taila can be used. In Dantaharsha, Trivritkrita, Tilataila, Gobruta, Dashamula Kashaya, Erendamula Kashaya, etc. can be used. In Danta Sharkara, Erendamula Kashaya, Dashamuladi Kashaya, Trivritkrita can be used for Kavala. In Chaladanta, Saptachadadi Kashaya, Kadiradi Taila, Irimedadi Taila, and Bakula Kalka can also be used. In case of Tundikeri, Kashaya prepared with ST, Trifala, and added with little amount of Tankana can be used. Also, Pata prepared with the Katuki, Rasna, Ativisha, Pata, Nimba, Pacha can also be used in Tundikeri for Kavala. In Kantashaluka, Taila processed with Vidanga, Danti, and little amount of Saindava can also be used. In Mukapaka, Kavala with Madhu, either of Madhu, Kshira, Grita, Ikshurasa, Dadimastu, Jati Mukula Kalka, Krishna Jirika Kalka can also be used. In Puti Asyata, Kavala with Irimedadi Taila, Lakshadi Taila, Jati Patradi Charvana, and also Krishna Jiraka Kalka Charvana can also be advised. Next slide. Gandusha, Sancharyo Mukhe Purne Gandusha, Gande Daryo Dravo Gandusha. Gandusha is a procedure where mouth is completely filled with medicated fluid such that it cannot be moved within the mouth. Matra, it is half, 1/3, and 1/4 of Mukha Purna for Avara, Madhyama, and Avara types, respectively. Next slide. Liquids for Gandusha. As per Bhava Prakasha, Tatra Sneha Kshiram Madhudakam Shuktam Madhyam Raso Mutram Dhanamlam Cha Yata Yata Kalkair Yuktam Vipakvam Va Yata Sparshe Prayojayet. That is Sneha, oil, ghee, etc. can be used for Gandusha. Milk, that is Kshira. Madhudaka, honey with water. Shukta, it's fermented gruel. Madhya, Mamsarasa, Mutra, Dhanyamla are commonly used in Gandusha. These liquids may be cooked or raw, and the liquid should be comfortable to touch and to hold in the mouth. These are the next slide. These are the specific yogas for Gandusha. In Vataja Voshta Kopa, Tilataila can be used for Gandusha. In Shitada, there is reference or one that is Kwata, Trifala, Musta, Sashapa, Shunti, and Rasanjana Kwata can also be used. In Danta Vesta, Gandusha also be used. In Danta Shula, Gandusha with Irimeda Taila and Lakshadi Taila is advised. In Krimi Danta, Gandusha with Esti Madhu and Madhu, and Erenda and Vagri Kwata, Medadi Bakla is advised. Gandusha can also be used. The Kwata is advised for Gandusha. In Indikeri, Kwata of Trifala, Vacha, Pushta, Eshtimadu can also be used. In Kanta Shaluka, next slide. Types of Gandusha. Chatushprakaro Gandusha, Snigdha, Shamana, Shodhano, Ropanasya. Gandusha is of 4 kinds, that is Snigdha, Shamana, Shodhana, and Ropana. Snigdha is a lubricating type of Gandusha. It is with the oils and fats. It is indicated for Vata imbalance disorders. Shamana is palliative type. It is for Pitta imbalance diseases. And Shodhana, it's purifying type. It is for Kapha imbalance diseases. Ropana for healing. Next slide. Snigdha Gandusha. Snigdho atra swadamla patusadisai. Snigdha Gandusha is by the use of oils processed with herbs of Madura, Ambla, and Lavana Rasa. Shamana Gandusha. Samshamanaha Tikta Kashaya Madura Oshadaihi. Palliative type of gargle is by the herbs of bitter, astringent, and sweet tastes. Shodhana type of Gandusha. Shodhana Tikta Katu Amla Saditahi. Shodhana Gandusha is with the herbs of Tikta, Katu, Amla and Lavana Rasa, and also with Ushna property. Ropana. For Ropana type
Excuse
of
me,
Gandusha.
doctor.
Yes, sir. Yes, ma'am.
Doctor, you are exceeding the time limit.
Okay.
Please
okay.
speed up.
Okay. Coming to the Samyak Lakshana, Vyadhe Rapachaya Tushtir Vaishadhyam Vaktra Lagavam, Indriyanam Prasada Gandushe Shuddhir Lakshanam. These are the Lakshanas of Samyak Gandusha Lakshana. Then coming to discussion part, local defense action of Gandusha and systemic action of Gandusha, and mode of action of, coming to the mode of action of Kavala. This an oral cleansing technique. The movement of Dravya generates the pressure inside the oral cavity and brings out the toxins and also the debris from the interdental gingival and gingival margins. Swishing the activates the enzymes and also reduces the Streptococcus mutans and thus helps to reduce the plaque accumulation. And the temperature and the potency of the drugs causes dilatation of blood vessels in the oral mucosa, which helps in assimilate the active ingredients of the medicines. Coming to the conclusion part, Acharyas have advised various measures to maintain the oral hygiene and health, which matches the guidelines provided by the American Dental Association. Dinacharyas explained by the Ayurveda is a boon to the mankind to preserve and maintain our health. Being the students of Ayurveda, we should know the importance of these procedures and make the use of it in day-to-day life and also in clinical practice. Thank you. Thank you for the opportunity.
Thank you, doctor.
Thank you, doctor.
Next, I invite Dr. Chiragdip, Ranjitsing, Deshmukh. I invite Dr. Chirag.
Hello, 1 minute, sir. Hello.
Your screen is visible, doctor. Please start the session.
Yes. Hello, myself Dr. Chiragdip, second year PG from Dr. D.I. Patel College of Ayurveda and Research Center. Today my topic is therapeutic procedure for Dhoopana Karma. So,
Dr. Chirag.
Hello, Dr. Chirag, are you there? Okay, next I invite Dr. Meenu Swaminath for the presentation. Dr. Meenu, are you there?
Yes, sir. Can I share?
Okay, doctor, please share the screen. Your screen is visible, doctor. Please start the session.
Okay, sir. Namaste to all. I, Dr. Meenu Swaminath from Department of RSPK, under the guidance of Dr. R.S. Hirmitha, sir, VM Kanganawadi Ayurveda Mahavidyalaya, hereby presenting the topic Phytochemical Analysis and Thin Layer Chromatographic Fingerprinting of Vibhidaka, Terminalia bellarica. Vibhidaka is a large deciduous tree found throughout India. Fruit, seed, and bark are the major part used. The bark of Terminalia bellarica is used as an adulterant to the bark of Terminalia arjuna. Vibhidaka included in Virechanopaga, Jarahara, Haridakyadi Gana, Mustati, and Trifala by the Acharyas. Here, the required raw materials are collected from Keli Ayurveda Pharmacy, Kaspai, Belgavi, and after authentication. The fruit pericarp was collected as the raw material. The analytical studies has been carried out at Ayush approved DTL for Ayush drugs, ASU drugs, Government of India, Kahar Sri BM Kanganawadi Ayurveda Mahavidyalaya. Results: the organoleptic study evaluation of Vipitaka was performed for the color, odor, and taste. So the color was grayish brown, odor was characteristic, astringent taste, and the part used was fruit. And the physicochemical evaluation has been performed, and it is according to the standardization parameters for the ash value, extractive value, and loss of drying, the extraction and identification of the marker compound. Preparation of the extract of Vipitaka was done separately by taking approximately 5 grams of Vipitaka powder and dissolved in 25 ml of ethanol and stirred for 1 hour by a magnetic stirrer, then left for maceration for 24 hours in a shaker. Each extract was filtered using Watchman filter paper, and this filtrate was used for further analysis. Here, the aqueous extract and the alcoholic extract has been taken. So the physical chemical characters are the loss on drying was 14.2%, the foreign matter 0.25%, total ash is 5.36%, acid insoluble ash 0.49%, water soluble ash extract is 36%, and alcohol soluble extract was 8.4%. The physicochemical screening also done, and as per that, it had shown the presence of carbohydrate, reducing sugar, then protein, tannins, alkaloids, saponins, steroids, flavonoids has been shown. So then was the thin layer chromatography. TLC study for Vipitaka was carried out as per the standard method. TLC study for Vipitaka has carried out as a technique in which an extract gets distributed between two phases. That is, it having a stationary phase and mobile phase. The stationary phase was pre-coated aluminum plate with silica gel, and the mobile phase was various reagents. So the development solvent was the solvent of the extract where 99.9% ethanol, and the mobile phase here used was chloroform, ethyl acetate, formic acid in a percentage of 5:4:1. So after preparing the mobile phase and the stationary phase, we have taken the sample and have dropped in the stationary phase, and then looked through the UV light in 254 nm, 366 nm, and 550 nm. That is the visible light. So we got the RF values like as given below, and the Vipitaka of alcoholic extract shown more RF value than the water soluble extract. So the discussion. Fruit is the fruit Vipitaka is bitter, pungent, and acrid, and it is digestible, laxative, and anti-helminthic. They are useful in bronchitis, sore throat, bilious, inflammation, strangulary, asthma, and in diseases of eyes, nose, heart, and urinary bladder. It is useful in dyspepsia, bilious headache, and diarrhea, and it is applied to eyes, piles, and used as a brain tonic. The fruit is combination with other drugs is prescribed for snake bite and scorpion sting. The physical properties and characteristic form of the drug, especially color, taste, and odor, form which are the specific identification of the drug. The moisture content, total ash, acid insoluble ash, water soluble ash, and extractive values are under APA limits only. The physicochemical screening shown the presence of primary and secondary metabolites like carbohydrate, reducing sugar, pentose sugar, hexose sugar, protein, tannin, alkaloid, androquinone glycoside, saponin, steroid, and flavonoid. As per the therapeutic property Vipitaka, all the phytochemical constituents already proven: anti-helminthic, analgesic, anti-inflammatory, and anti-diarrheal activity. Thin layer chromatography is a golden preliminary tool for qualitative screening of the constituent present in a single or compound herbal formulation. The alcoholic ester shown more RF value than aqueous extract implies the polarity of the secondary metabolites. Sadhana Mishra Vajpayee et al. In 2020 reviewed that Vipitaka is indicated by Acharya Vakpada in all types of Shwasa and Kasa. Vipitaka is Kashaya Rasa, Madhura Vipaga, Ushna Virya, and Legu, and Ruksha Guna, which plays a major role in relieving Kasa. Javarjal H. et al. At 2012 conducted the anti-ulcer activity of 70% methanolic extract of Vipitaka and proven its potency. Sabu MC et al. In 2009 conducted the study on effect of continuous administration of dried 75% methanolic extract of fruit of Terminalia bellarica suspended in water and proven the anti-diabetic and antioxidant activity. So the conclusion, Vipitaka having diverse pharmacological spectrum because of the presence of enormous phytoconstituents like mannitol, tannin, gallotannin, bellaricanin, gallic acid, flavone, ellagic acid, glucose, etc. It needs to be explored furthermore to understand the pharmacological action in various diseases and its purpose in the usage in different compound formulation. Thank you. These are the reference. Thank you.
Thank you, doctor.
Thank you, doctor.
Thank you, sir.
Now I invite Dr. Shubham Pramod.
Hello, ma'am. Am I audible?
Yes, doctor. Audible, doctor. Please share
Can
the
I share
screen.
my screen?
I invite Dr. Shubham Pramod.
Shubham Pramod Dhawale.
Yes, doctor. Can you please share the screen, doctor?
Yes, sir. Is my screen visible?
Yes, doctor. Your screen is visible, doctor. Please start the session.
Okay. Yes. Am I audible?
Yes, doctor,
You
you're
are also
audible.
audible, doctor. Please continue.
Good evening, everyone. Thanks for giving me a chance to present my paper here. My name is Dr. Shubham Pramod Dhawale. I am BMS third year scholar in the Ravi Vigyan department. My college name is Bhausai Morak Ayurved Mahavidyalaya, Nandanvan, Nagpur. So my title of the paper is Introduction of Brahmi, that is Bacopa monnieri Linn plant and its morphological and phytochemical study. Abstract. Brahmi, that is Bacopa monnieri Linn, is important district medhya, that is no tropic dravya mentioned in Indian system of medicine. Lack of morphological description leads towards confusion in identity of this plant. The extension of valuable medicinal plants of the ancient India is well explained by Mr. J.L. Stingle in American Journal of Pharmacy for 1920 that with the progress of civilization, the plant has diminished. He says the scarcity of this valuable drug cannot be entirely attributed to lack of plants or due to extinction, but to other conditions which tend to prevent identification at the time of collection. Hence, the detailed phytochemical documentation of this plant is planned in the present investigation, which helps to identify the plant more precisely. My keywords are Brahmi, Bacopa monnieri, morphological study, phytochemical study. Introduction. Ayurveda, the science of life, considered as Upaveda or Upanga of Rig Veda, in fact, originated prior to the Vedas. Rig Vedas, which is one of the oldest books in the library of the man, supplies more information on the subject. From it, we come to know that Indo-Aryans use the soma as a medicinal agent, whereas the plant is not yet satisfactorily identified. The knowledge of medicinal plants must have been accumulated in the course of many centuries. Aindri Brahmi Shatavirya Sahasravirya Amugha Avyatha Shiva Arishta Vatya Pushpi Vishwaksena Kanta Iti Dashemani Prajasthapanani Bhavanti. As per above shloka, according to Acharya Charaka, as he mentioned, the Indri and Brahmi Prajasthapak Mahakashaya. Nowadays, we know that Indri is Bacopa monnieri Linn and the Dravyas Vigyan by Dr. Sharma described the Indri is Brahmi. As per this, we can conclude that Brahmi is Medhya Dravya as per ancient science of Ayurveda. Drug review. Main features. A Brahmi is creeper which grows in marshy areas. It is considered to be a sacred plant. It is indigenous and found all over India. It is used by sages. It improves intelligence and memory power. It is a small creeping marshy herb with branches 20 cm. Leaves. Leaves are sessile, 6 to 25 leaves on each branch. Length is around 2.5 to 10 mm above it. Flowers. Axillary, solitary, bracteolous, 5 mm long. Linear. Pedicels are 0.6 to 3.2 cm long, slender. Calyx is glabrous, corolla pale, blue or almost white, 8 mm long. Lobes are nearly equal. Anther is bluish purple. Fruits, capsules 5 mm long, ovoid, acute, pointed with style. Base is glabrous, seeds about 0.85 mm long, oblate and pale. Useful parts are whole plant. Taxonomical classifications. Kingdom Plantae, subkingdom Tracheobionta, superdivision is Spermatophyta, division Magnoliophyta, class is Magnoliopsida, subclass is Asteridae, family is Scrofulariaceae, genus is Bacopa, species is Bacopa monnieri. Vernacular names. Sanskrit called as Brahmi. In Bengali called as Brahmi sac, Jalanimba. In English called as thyme leaf gratiole. In Hindi, Brahmi, Jalanima. Kannada, Niru Brahmi. Malayalam, Nir Brahmi. Marathi, Brahmi, Nir Brahmi. Tamil, Niripirami. And in Telugu called as Sabrani Chetu. Ayurveda view according to Raj Nighantu. Rasa is Tikta, Guna is Laghu, Virya is Usna, Vipak is Katu, and Prabhav is Medhya Dravya. Gana is Prajastapak Mahakashan. Dosha karma are Kafavata Shamak. Other karma are Shuthahara, Vedana Stapak, Vishagna, Medhya, Akshepahara, Dipan, Pachan, Rakta Stambhak, Rakta Shodhak, Kanthya, Mutral, Artojanak, Swedajanak, Kandugna. Prayojya Anga is Panchanga. Phytochemical study. Phytochemistry is the branch of chemistry that deals with the nature of the plant or plant products. Chemistry of the natural products. To do phytochemical study of plant, it is recommended to perform HPLC, high performance liquid chromatography. High performance liquid chromatography, that is HPLC, formerly referred as a high pressure liquid chromatography. It is technique in analytical chemistry used to separate, identify, and quantify each component in a mixture. I perform HPLC report of Brahmi. My report is like my sample of the Brahmi that contains phenolic acid, phenolics, or aliphatics, that is, number of components are 2, contribution is 2%, phytoamines and alkaloids are 6, 32% is Brahmin, polyphenols, flavonoids, or antioxidants, I found 10, contribution is 25% of the apigenin, rutin, myrcene, and terpenoids are 5 to 6.5% contribution of the bacoside derivatives. Bacosides are significant components of Bacopa monnieri and play essential roles in mental health. It also protects the cytotoxicity and DNA damage of neurons implicated in Alzheimer's disease and repairing the impaired neurons by enhancing kinase activity and neuronal synthesis. Antioxidants. Antioxidants are substances that may protect your cell against free radicals, which may play a role in heart disease, cancer, and other diseases. Free radicals are molecules produced when your body breaks down food or when you are exposed to tobacco smoke or radiation. Some photographs of the Brahmi plant. Conclusion. The morphological study of Brahmi, that is Bacopa monnieri Linn, helps in identification of plant in wet form. Phytochemical study reveals presence of aliphatic acids, alkaloids, that is Brahmin, antioxidant, that is apigenin, rutin, myrcene, and terpenoids. It can be suggested that Brahmi, that is Bacopa monnieri Linn, have anti-convulsant properties and can be used in management of the stress. Some references are Professor Priyavesh Sharma, Dravya Vigyan, Volume 2, year 2020, page number 3 to 6 and 6 to 8. Professor K.C. Chunekar, Bhav Prakash Nighantu, Indian Material Medic of Sri Bhav Mishra, year 2010, page number 446 to 449. Dr. Brahmanand Tripathi, Charak Samhita, Volume 1, year 2008, page number 80 to 86. Dr. Hiremat Shobha, GA textbook of Bhaishajya Kalpana, Indian Pharmaceutics, first edition, 2000, page number 456. Indian Drug Manufacturers Association, Mumbai, and Regional Research Laboratory, Indian Herbal Pharmacopoeia, Volume 1, year 1998, page number 47. Government of India, Ministry of Health and Family Welfare, Department of Health, the Ayurvedic Formulary of India, year 1978, page number 35. Indian Council of Medical Research, Medicinal Plants of India, Volume 1, year 1976, page number 118 and 121. Thank you, sir.
Thank you, Dr. Shubham Pramod Dhawale. Next, I invite Dr. Girish B R for the paper presentation on the topic Siraveda. Dr.
Yes,
Girish,
sir.
are you there?
Yes, sir.
Okay, doctor,
Can
please
you
share
hear
the
me,
screen,
sir?
doctor.
Yeah,
Yes,
I'm
doctor,
sharing,
you
sir.
you are audible, doctor. Please share the screen.
1 minute, sir. I'm doing. Yes, sir. Is it visible, sir?
Yes, doctor, screen is visible. Please start the session, doctor.
Yeah. Myself. Good evening, everyone. Myself, Dr. Girish B R, from the Department of Shalya, second year PG scholar, Sri Kalavareshwara Swami Ayurvedic Medical College and Research Center, Bangalore, under the guidance of Dr. Shesha Sai. Introduction: Etymology of Siraveda. Sira, Sino, Tautat Itat Siraha. That means which binds are a quantity of bound together. It is found from the root to bind any tubular vessel of the body, vein or artery, as they are binding the whole body together, transporting blood to all over the body. Vyadha, Vyadhanimatata Vyadaha, that gives a meaning of cuts. Vyadha, Tada, Annavyadha, to Anvyadha, to pierce, to transfix, to hit and strike the wound, by which the blood is being taken all over the direction is Sira. Its piercing is known as Siraveda. Number and distribution of Siras. Total there are 700 Siras is mentioned by the Acharya Sushruta. By these Siras, the entire body is constantly nourished, kept moistened to perform the bodily functions, similar to a large field being nourished by small channels of water. Vedhya and Avedhya Siras. Acharya Sushruta has mentioned, Acharya described Vedhya Siras are those which can be considered for therapeutical purpose, and there will be no serious complication when affected or injured. Avedhya Siras are those which the injury must be avoided during surgery. In Samhita period, Charaka described two Vedhya Siras in the context of the disease Unmada, Vishamajvara and Apasmara are the two places. They are Shanka Pradesha and Keshanta Pradesha. Vedhya and Avedhya Siras. There are 700 Siras in number. Vedhya Siras are 602, Avedhya Siras are 98, and Avedhya Siras are divided in 3 regions. Shakhagata 16, Koshtagata 32, and Urdhva 50. Indications of Siraveda. According to Sushruta Sutrasthana, 25th chapter, he says, Sravya Vidradhyaha Pancha Bhavetu Sarvajate Kushtani Vayu Sarujaha Shofo Yash Ekadashe Deshajaha Palyamayaha Sleepadani Vishishtam Cha Shonitam Arbudani Visarpascha Grantest Ardidascha Trayas Chopadam Shaha Stanarogaha Vidarikaha Shudra Rogasha Bhuyashaha. These are the indication given by the Acharya Sushruta for Siraveda. Then few more conditions added by the Acharya Vagbhat are like the Vyadhi, which arises out of Pitta and Kapha diseases, which do not respond to Shitoshna Snigdha Ruksha Chikitsa. That is Aushadha Chikitsa, should be understood as being born from the Dushta Rakta, and Rakta Mokshana should be performed. These are the contraindication for Siraveda. According to Sushruta Sutrasthana, 14th chapter, Atha Avisravyaha Sarvanga Shobhaha Kshinasya Cha Amla Bhoja Nimittaha Panduroga Arshasodari Shoshi Garbinanam Cha Shvaitaha. According to Sushruta Sharidasthana 8th chapter, he mentioned few more contraindications for Siraveda. Bala, Sthavira, Ruksha, Kshatakshina, Bhiru, Parisanta, Madhyapa, etc. These are the contraindications explained by Acharya Sushruta. Vamita, Pirikta, Astapita, Jagarita, Anuvasita, Kliba, Krisha, Garbini, Kasa Shwasa Pidita, etc. These are the few contraindications according to Acharya Sushruta explained in Sushruta Sharirasthana. These are the sites of Siraveda explained by Acharya Sushruta in Sharirasthana. The sites are, for example, in case of Vata Shonita, Padadari, Padadaha, he explained to do Siraveda 2 angula above the Kshipramarma. These are the multiple places to do Siraveda in different conditions. Siraveda Vidhi. The mainly Siraveda Vidhi can be classified into 3 categories. That is Purva Karma, Pradhana Karma, and Paschat Karma. In Purva Karma, Sambhara Sangraha, Atura Siddhata. Sambhara Sangraha. For better performance of Siraveda and for the management of complication, the following materials should be arranged prior to the procedure. Taila for Abhyanga, Nadi Sweda Yantra for Svedana, surgical spirit, cotton swab, gauze pieces, bandage roll, tourniquet, scalp vein, set number 16, 18, and 20, depending upon the prominent vein, kidney tray, glass beaker to collect and measure the amount of blood drained. The instruments used for Siraveda: Kutarika, Vrihimukha, Araveda Sapatra, Suchi. Atura Siddhata. Snehana internally for 2 to 3 days, and then Abhyanga and Svedana to the affected part or to the whole body should be done on the day of Siraveda. Yavagu which does not aggravate dosha but pacifies the dosha should be given just before Siraveda in order
Doctor.
Hello, can I audible?
Yes, Doctor.
Yes,
Audible,
doctor, you're audible.
Yeah, I'll continue. 1 minute. Pradhana Karma, Siravedhanartha Asana, Siraveda and Nirakshana, Samyak Yogya and Ayogya Lakshana of Siraveda, Vyapad and its Chikitsa. Siravedhanartha Asana. Depending upon the site of Siraveda, surgeon should decide the position of the patient. Example, supine position in case of Ekratodara, sitting posture in case of Sirajagranthi. Vedana Pramana. According to Sushruta, Sharirasthana, he explained the Pramana of Vedana. Depending upon the place, Mamsaleshva Avakasheshu Yavamatram and Shastram Nidadyan, Atho Anyata Artha Yavamatram, Vrihi Matram Vrihi Mukena, Asnamopari, Kutarikaya Vidyed Artha Yavamatram. Depending upon the different location, he advised to go for he advised different Pramana. Vedana Kala, that is suitable time for Siraveda. Naivati Shite, na Tyushno na Pravate na Chabrite. Siranam Vedhanam Karyam Rogo va Kadachanaha. Siraveda should not be performed in extreme cold, extreme hot, a windy and cloudy day. It is prohibited in a healthy individual. Vyabhre Varshas Vidyetu Grishma Kaletu Shitale. Hemanta Kale Madhyane Shastra Kalastraya Smutaha. That is in case of Varsha Ritu, Siraveda should be done when the sky is clear. In Grishma Ritu, it should be done when it is cool. Hemanta Ritu, it should be done in the afternoon. Srav Pramana, the quantity of blood should be removed. 1 prastha is advocated as the maximum limit of bloodletting in a strong adult person with excessively vitiated dosha, that is Bahu dosha avastha. In this regard, Dallana advised that blood should be let out in order, that is 1 prastha, approximately 768 ml in Uttama Matra, half prastha, 384 ml Madhyama Matra.
Excuse me, doctor.
Hello.
Doctor,
Yes,
you're
ma'am.
exceeded the time limit. Speed up your presentation.
Yes, ma'am. Yes, ma'am. 1,4 Prastha in 192 ml. That is Hina Mata. Samyak Vidya Lakshana explained by the Acharya. Samyak Shastra Nipadina Dharaya. Yes, Sraved Asruk Muhur Tishchecha Suvidhyata Vinodishet. These are the multiple Lakshanas explained by the Acharya Sushruta in a Sharira Sthana and Sushruta Sthana. Hina Vidya Lakshanas Taddushtam Shonitam Nirhyamanam Shofadaha Raga Paka Vedana Janai. That is, in case of Hina Vida, these are the Lakshanas will be seen. Causes for like Hina Vida, Mada Murcha Shramatana, Durdina, Durvidya, Shita Vatayo, Asvinna, Bhukta Matre. Management of Ayoga. According to Sushruta, if the blood does not flow out, then Yela, Kushta, Tagara, Patra, etc. These the churna of these drugs should be rubbed over the Vedita site. Atirakta Srava Karana. According to Sushruta, Atyushna, if the Siravada is performed in Atyushna Kala and the patient is Atisvinna, Adividha, and done by the person who is not well versed in or inexperienced, then it leads to Atirakta Srava. Atirakta Srava Lakshana, Shiro Abhitapa, Andhya, Adhimanta, Timira, Dhatukshaya, Akshepaka, Pakshagata, Ekanga Vikara, Ikka, Shwasa, Kasa, Pandu, Varana. These are the Atirakta Srava Lakshana. Management of Atirakta Srava. One of the major complications which may lead to a sudden death is Murcha. If a patient becomes unconscious while performing Siraveda, the following points should be considered. Immediate removal of the instrument, cold packing, cold water sprinkling, and consolation and assurance of the patient. Management of Atisrava. When the blood flows out excessively, powder of Lodra, Madhuka, Priyangu, etc. These should be sprinkled and pressed with a tip of the finger on the wound or churna of the bark of Sala, Sarja, Arjuna, Meshashrungi, etc. Then a tight bandage tightly using a bandaging material. The patient should be covered with a moist cloth, put in a cold room, treated with application of poultice and pouring liquids in cold condition, or the area may be burned either with Kshara or Agni Karma. Raktasrava Nirodhaka Krama, methods of preventing the bleeding. These are the 4 methods explained by the Acharya Sushruta: Sandhana, Skandana, Pachana, Dahana. Drugs with astringent will join or unite the wound. Drugs which are cold makes the blood to clot. Ash or alkali drugs will adhere and closes the wound, and cauterization will constrict the vessels. Pashat Karma, Atura Paricharya and Parihara Vishaya. After completion of procedure, whenever the blood flows stops automatically, yantrana should be removed. Tight bandaging should be done. By the depletion of the tissue due to bleeding, Agni becomes weak and Vata Prakopa will be there. Hence, the patient should be administered with the food which is not very cold, which is light and untouched, which promote blood formation and either slightly sore or divide of sore. The food which consists of takra with yusha yavagu peya should be given to the patient. Parihara Vishaya. After bloodletting, the patient should avoid vyayama, exposure to Shita Vayu, Diva Swapna, use of Kshara Dravya, Katu Ahara, Shoka, etc. All these must be avoided at least for 1 month. Mode of action of Siraveda. This occurs the stimulation of Ekrut Pliha, which are the root Raktava Shotas. When these organs are corrected, when the whole of the Raktava Shotas get corrected, Rakta Moksha decreases the workload on Raktava Shotas and thus Ekrit and Pliha. The Sandrata and Dravata and pressure on Raktava Damani are corrected. One more way is Pitta Shodhana. By Rakta Mokshana, Pitta Shodhana occurs as the Rakta is a seat of Pitta. According to modern science, bloodletting acts as in following way. The diminution of the mass of the blood by which the overloaded capillary or large vessels are affected part may be relieved. The modification of the force
Dr.
of... Yes, ma'am?
Please speed up the presentation.
Yes, ma'am. According to mode of action of Siraveda in different conditions. First one is pain management. Siraveda mainly acts on Pitta and Rakta, Pitta Kapha Rakta, or Pitta Kapha associated with Vata In such condition, Vata Prakopa leads to Avarodha and Kapha and Pitta. Siraveda removes the Avarana and allows the Vata normal gati and reduces the pain. Modern science says stimulation of larger sensory fibers from the peripheral vessels receptors depresses the transmission of pain signals either from local area or a segmented area and manages the pain. In case of Plihodara, there is enlargement of spleen. The spleen is heavy and firm by bloodletting the left-sided median cubital vein. The reticulo-endothelial cells of spleen rapidly removes debris, bacteria, and parasites. Usually, reserved blood is ejected into the general circulation. The fragile RBCs are washed off. Splenic vein is drained effectively. The classical anatomical surface landmark of Siraveda is Kurparamarma. In case of Ekrutodara, right-sided median cubital vein is used, ejected into the general circulation to cause decongestion. Epinephrine and norepinephrine hormones are released, mobilizing fatty acids deposited in the liver. Hepatocellular enzymatic activity is improved. Fresh RBCs are produced to utilize the ferritin. By all these effects, enlargement of the liver can be reduced. So the site is considered Siraveda for Ekrutodara is Kurpanamarma. In case of Sirakranti, Siraveda helps in increase the pumping action of the vein by creating a negative pressure, diffusion of RBC into the tissues. Its lysis release the hemoseridine causing pigmentation is avoided by the RBC, removal of RBC. The free iron is utilized by the fresh blood flowing in, thus pigmentation does not occur. The breakdown of RBC also stimulates histamine at the site causing vasodilatation, vascular permeability, and itching may be further lead to eczema, but all these prevented by the Siraveda. Kasa. In case of Kasa, cough as a defense mechanism of the body. When the bloodletting is done in the right-sided median cubital vein, the venous pressure in the right atrium may be decreased, resolving pulmonary congestion. So the site may be considered as a surface landmark is Kurpanamarma. In Shwasa, the condition may be considered as a breathlessness by bloodletting in the right median cubital vein. The congestion of the lung, liver is decreased. So the verdict of Acharya Sushruta can be accepted as a surface landmark is Kurpanamarma. Vishwachi, a brachial plexus neuritis. By bloodletting 4 angula above the Kurpara Sandhi,
Dr.
cephalic
Girish,
vein. Yes, ma'am.
I'm repeating the same. Speed up the presentation.
Yeah, like few more slides, ma'am.
Only 8 minutes for one presentation.
Yeah. Importance of Siraveda. Snehadibihi kriya yogirna tata lepanayrapi yatyanchu vedayah shanti tata samyek Siravedat. Among all the treatment methods for Sadhya Roga, Siraveda is the best. Just like how the paddy and the other crops die out of completely by removing the burns of the field. This procedure helps to eliminate the diseases completely. When other treatment fails, Siraveda has to be done for Rakta Prakopaja Vikaras. Siraveda Chikitsa Ardha Shalya Tantre Prakirtitha. Todosha Grantheha Shofa Roga Shonitaschaye Raktamokshana Shilanamna Bhavanti Kadachanaha. Discussion. Siraveda is being one type of Raktamokshana therapy as per Acharya Sushruta and Vagbhata. It is nothing but letting of blood outside the body, which is one measure described in the treatment of diseases caused by Raktadushti. In 11 marma, each extremity, 2 sira marma, which are not fit for vein section because these 2 marmas are situated in the area where the majority of the blood vessels passes. Injury to these vessels will lead to hemorrhage, which causes hypovolemic shock, and later death will occur. By these, we came to know that marmas are considered as a classical anatomical surface landmark, and one should care about these vital points while doing Siraveda. Its form of venipuncture and the difference in Siraveda is employed in a single therapeutic procedure in order to treat a disease condition, whereas venipuncture may be diagnostic or a part of therapeutic procedure rather than being an independent treatment procedure. Conclusion. When other treatment fails, Siraveda has to be done for Rakta Prakopaja Vikaras. By studying anatomical and clinical importance of Sira and Siraveda, we can say that Siraveda is beneficial in managing number of diseases. The concept of marma is also an important classical anatomical landmarks for the Siraveda. The knowledge of Marmasthana is required to carrying the Siraveda. It is helpful in eliminate the doshas directly from the shakas. No need to bring them in koshna like other purification procedures. Thank you, ma'am.
Thank you, Dr. Girish. And before going to the next presentation, dear participants, I'm repeating the same. The panel is strictly reminding you the time duration. You have to make and present a presentation within a time period of 8 minutes or maximum in a time period of 8 minutes. You should follow that. That is one among the criteria. So next I invite Dr. Chiragdip Ranjitsing Deshmukh. I invite Dr. Chirag.
Hello.
Your screen is visible, Dr. Chirag. You are
Yes.
also audible.
Hello. Myself, Dr. Chirag Deshmukh, second year PG from Dr. D. Patel College of Ayurveda and Research Center. Sir, I am audible.
Yes, Doctor,
Hello.
audible. Please continue,
So,
Doctor.
Karna Dhoopana. Dhoopana means fumigation, where we burning of drugs of plant, animal, and mineral origin, which have specific properties. Dhoopana is used to heal Vrana, that is wound, Nasa Roga, Karna Roga, and Yoni Vapor. Dhoopana is integral part of Raksha Vidhi, which ensure protection against microbes. So, Karna Dhoopan is a specialized and effective Ayurvedic treatment to cure that ear diseases. Here, Acharya Charak, Sushrut and Vagbhat had mentioned variety of Dhoopan properties. We all know Mahabhuta Pradhan Dravya of Dhoopan Karma are Agni and Vayu. We get various reference from Samhita where Karna Dhoopan is mentioned. Acharya Sushrut mentioned Karna Dhoopan in Sashti Upakta. Dhoopan Dravya are mentioned in some different adhyay also. Karna Dhoopan for the treatment of Karna Roga is described under Brihat Prai. Next slide is qualities of Dhoopan Dravya. These Dravya are Laghu, Shita, Ruksha and Vishada. Advantage of Dhoopan Karma is it is a rapid and spread ability and quicker action. Dhoopan Dravya are volatile in nature and Dhoopan Dravya are antifungal, analgesic and antimicrobial properties. Some Dravyas which is used Karna Dhoopana, that is Guggulu, Agaru, Vacha, Gaura Sharshapa, Nimba Patra, Hingu and Haridra. Next, Guggulu is Laghu, Rukshan, Ushna, Virya, acts against Kapha dosha, specially mentioned as a best Dravya under Karna, Daurgandha Hara, Dhoopan Dravya. Next is Vacha. Vacha is Laghu, Ruksha, Ushna, Virya and belongs to the Shanga Sthapan Gan. Next is Nima. Neem is Katu, Tikta, Rasha, Laghu, Ruksha, Guna, Shita, Virya and thus relieves the vitiated Pitta dosha. Neem. Next is Agaru. Agaru is Laghu, Rukshan, Tikshna Guna. Rasha is Katu, Tikta and Virya is Ushna and Vipak is Katu. Next slide is pharmacological action of Dhoopan Dravya. Here we see the pharmacological action of Karna Dhoopan Dravya are Shotahara, Vrana Shodhan, Vrana Ropan, Vedana Sthapan, Daurgandha Hara and Krimigna properties. Karna Dhoopan are used in various diseases like Karna Strava, Puti Karna, Krimi Karna and Karna Kandu. Here are some pictures of different diseases where we use Karna Dhoopana. Next, method of preparation and administration. We take all the Dravya in 24 grams total, burnt in a Dhoopan yantra and fumes generated. Fumes generated for 3 minutes. After 3 minutes, Dhoopan is stopped. External auditory canal is closed by sterile cotton ball. Similarly, repeated for 10 days. Conclusion is, it is a best mode of treatment in management of ear diseases Karna Dhupan can be better local treatment as disinfectant. It is eco-friendly and cheaper. Further work has to be done for the standardization and better methodology. Thank you, sir.
Thank you, Dr. Chirag.
Tiger Point.
Next, I invite Dr. Kadam Kanchan Shivshankar for the paper and poster presentation.
Hello. Good evening, sir.
Good evening, Doctor. Please share the screen, Doctor.
Yes. Error. Sir, can you please share my paper?
Okay, Doctor. Just a moment.
Yes.
So please start the session, Doctor.
Yes, sir. Hello. Good evening, everyone. Myself, Dr. Kanchan Shivshankar, third year PG scholar from CSMSS Ayurved Mahavidyalaya, Kanchanwadi, Chhatrapati Sambhajinagar. Today's my paper presentation topic is an approach toward understanding the scope of Deva Purushkarvad in Ayurveda. A review. Introduction. Devinism has been accepted as a life-affecting feeling by imbibing the science of life. If there is an anger of God, then different type of disease arises. Those diseases are called Adidevik or Deva Bala Pravrutta Vyadhi. Here, Deva means fate because fate is considered as a creator-operator, and term Purushakar means duty or Purushartha performed by a particular person. So here, Deva Purushkarvad means fate and duty. According to Sharir Adhyay 2, the case of disease and health, the mention of Deva and Purushkar is presented as the deeds done in the previous birth is called Deva, and deeds done in this birth is called Purushakar. There are difference between Deva and Purushakar, as if one is stronger and one is weak, then there is an origin or tendency of disease. And when the two meets, then the patient becomes free from the disease or the patient becomes Swasthya. Aim of my study is to discuss and elaborate Deva Purushkar Vada. Materials. Materials and methods. This paper is based on a textual review. Material related to Deva and Purushakar was collected from Charak Samhita, Chakrapani Tika, and Ayurvedic texts were used to collect the information on this relevant topic. Deva Purushkar. Devam Purushakarena Durbalam Upahanyante, Devena Chetrat Karma Vishishtena Upahanyante, Društva Yadeke Manyante, Niyatam Manamayusha, Karma Kinchit Kwachit Kale, Vipake Niyatam Mahat, Kinchit Vakala Niyatam Pratyaya Pratibodhete. The age of living being except Yukti, the strength of this bala is depends on both Deva and Purushakar, that is fate and karma. Acharya Charak says that karma yat parvadevikam, that is fruit received according to deeds in the previous birth is called Deva or Bhagya, and deeds done in this birth is called Purushakar. Next slide, sir. There are three types of karmas as a Heen, Madhya and Uttam. When both the Deva and Purushakar are Uttam, then combined result of both gives long and healthy life with a pleasure. If both the Deva and Purushakar are Heen, then their combined result is short life with sorrow. When both the Deva and Purushakar are moderate, then the person will get moderate happiness and moderate life. If it has been said again, the strong Purushakar destroyed weak fortune and vice versa. On this basis, some people consider age are fixed. Age is a fixed, but man thinks that he or she getting sorrow or happiness by luck only. But it is not totally correct, because whether karma is man will get result, whatever the karma. types of karma, there are 3 types: the hina karma, madhyam karma, and uttam karma. This is diagrammatic representation. Uttam Daiva plus Uttam Purushakar turns into moderate and happy life. Second. Next type, sir. Hin Daiva and Hin Purushakar turns into short life with sorrow. Discussion. The lifespan of living being depends upon proper coordination of 2 factors, namely Deva and Purushakar. Deva in previous life, while Purushakar stands for one's action in this life. If person has done austerity, charity, kindness, and charitable deeds in the previous birth, but in this birth he may have caused pain to someone, then he get the result accordingly to strong virtue he has done in the past. Next slide, sir. In this situation, the general public has same concept that he is getting the fruit due to deva or luck, while the fact is that the getting the result his own action according to deeds of his previous birth. Similarly, if someone has committed mainly heinous crime in previous birth and going to some charity in this birth, then also the person gets sorrow and short life according to strong inauspicious deed of the previous birth. This duration of the action is not fixed. Conclusion: sometimes it happens in some diseases even after complete treatment. There is no cure. Then the disease become incurable by karma. If the same disease occurs in 2 different persons, one gets cured quickly and other does not get cured. This also happens because of Deva Purushakar. These are the references. Thank you.
Thank you, Doctor. Next is a poster presentation.
Yes, sir. Can you share, please, sir?
Sure, Doctor. I'll share for you. Just a moment, Doctor.
Yes, sir.
Doctor, please start the session, Doctor.
Yes, sir. Hello, everyone. My poster presentation topic is seasonal regimen according to Trivid Hetu Sangraha. Introduction. The term Ritucharya refers to the ancient Ayurvedic practice. 1 minute, sir. Ancient Ayurvedic practice, and it makes up the word of the word Ritu, that is season, and Charya, that is regimen. Ritucharya is an Ayurvedic lifestyle and dietary regimen designed to help the people deals with the physical and mental efforts of a seasonal changes. Ritucharya helps us to develop our physical and mental strength so we can fight off illness caused by the seasonal changes. Additionally, it maintains a balance between 3 doshas in our bodies and keep us strong and healthy all year. The 3 causes of both the causes of both physical and bodily disease are incorrect use, avoidance, and excess use of time, intellect, and sense objects. Right now, all the seasons are not running equally. That's why many diseases are happen. Ritucharya is the only way to save yourself from the diseases. Aim of my study is to study the Trivid Hetu Sangraha with a special reference to Varsha Ritucharya. There are 3 types of yoga: Hin Yoga, Ati Yoga, and Sama Yoga, Mithya Yoga. Hin Yoga is loss, which means that the deficiency is seen in the specific kal symptoms, such as less rain than usual during the rainy season or less cold than usual during winter. Mithya Yoga, the opposite nature or character, is called Mithya Yoga. Excess heat in winter, excess cold in summer, and lack of rain in monsoon is called Mithya Yoga. Third type is Ati Yoga, when the symptoms of Kaladi are more than normal, it's called Ati Yoga, like more rain in rainy season or more heat in summer. Sama Yoga is a proper environment Pathya, Pathya, Ahar, Madhur, Amla, Lavan, Snigdha, and Ushna Dravya, old wheat, rice, and barley, gruel prepared with pulse, food and drink with honey, boiled and cold water, yusha, jungle masa, and liquor. We are living in dry place, wearing of light clothes, paragrahashan, Udvartan, Basti, Vaman, Virechan, use of flowers and perfumes. Apatya are Ruksha and Atidrava Dravya, Udmanta, river water. We are Divaswap, Vyayam, living under dew, eastern wind, excessive sunlight exposure, or intercourse. Discussion: climate changes is already happens, therefore we need to act immediately. As we pass through the 6th season, our bodies are destined to undergo diverse changes. Hence, if the same pattern is followed throughout the year, it is likely to have adverse impact. The preservation of dosh balance through the concept of samanya and vishesh in the central principle is the central principle of Ritucharya. Ritucharya knowledge and regular observations are important for preserving health and preventing health and preventing sickness. There are and vihar from different season. For ill patient, Ritucharya has been adjusted as a need. Everyone should consume a diet that includes all rasa, regardless of the season. Nevertheless, the recommended rasa should be consumed in a greater amount. This is the 6 Rutus. Thank you.
Thank you, Doctor. Next, I invite Dr. Amrita Machindra Paul.
Good
I
evening,
invite
ma'am.
Dr. Amrita. Good
Yes,
evening, Doctor.
ma'am. Good evening, ma'am. Thanks for giving me that opportunity. Just
You're
wait,
welcome,
ma'am. Sharing my screen.
Yes, sir.
Just 1 minute, ma'am.
Your screen is visible, Doctor.
Just 1 minute, sir.
Okay, Doctor.
So, is my screen is looking? Is it visible?
Yes, Doctor. Visible, Doctor. Please start the session.
Is it visible now?
Yes,
Hello.
Doctor. Visible, Doctor.
So I'm Dr. Amrita. I'm from the SMBT Medical College, Nasik. I'm studying PG in Prasuti and Stree Rog in final year. My main topic is the Sthanik Chikitsa in Univapadas. So this is an introduction. Most of the time in allopathy, we use the allopathic medicines in the form of the local applications and various forms to the gynec patients and obs patients. But here we are introducing that Ayurvedic preparations which we are using for the Sthanik Chikitsa in most of the females. This is a general introduction. I'm not going to waste my time in this. So this information is available in our most of the books, mostly in the Charak Chikitsa. It is available in the Chikitsa Sthana Adhyay. It is in 30th Adhyay of the Chikitsa Sthana, that is Univapadas. It is available in Sharandha Samhita. It is available in the Vagbhat. It is available in the Madhav Nidan. It is available. The description is also found in the Bhav Prakash. Sharandha Samhita has mentioned number of Univapadas as the 20 in Roggan Adhyay of Purva Kanda. Description is available in Yog Ratnakar. In Bhaishyaja Ratnavali also mentioned about Univapadas and various Sthanik Chikitsas of Univapadas. So most of these acharyas have explained about the various Sthanik Chikitsas, which includes Yoni Dhavan, Yoni Parishek, which we call as vaginal douche, Yoni Pitsu, which we call as a tampons, Yoni Dhupan, that is a fumigation, Yoni Varti, that is like our allopathic pastries, Yoni Puran, which is the vaginal packing. Now, role of action of various Ayurvedic drugs in Sthanik Chikitsa in Yoni Vyapadas. Now here I'm explaining the various Ayurvedic drugs which we are using in the Yoni Vyapadas in various Sthanik Chikitsas. First Sthanik Chikitsa is the Yoni Pitsu. What is the Yoni Pitsu? In allopathy we call it as a tampons. So here are some drugs which I am going to explain. It is not the very big list, just these are some examples. So tampon soup with the oil prepared with the juice of the rat milk, we use it in Yoni Kanda. Tampon soaked with Guduchadi tail, we used in Vata Yoni Vapat. Tampon soaked with Kwat of Dasagrinda Srimada, we used in the Sanipada Yoni Vapat. Tampon soaked with the Til tail, we used in the Vata Yoni Vapat. So these are the various tampons which we used in the various types of the Yoni Vapadas with the preparation of the various drugs. The next Yoni Varti, second one. This is Yoni Vartis are pastries. So, my topic is the vaginal candidiasis. I have prepared my own vaginal pastries that I have prepared it from the Panchavalkal Varti. So it is also like that, the Yoni Vartis, that is pastries. Pastries prepared, some examples are here. Pastries prepared with the bile of hog used in the Kapha Yoni Vapat. Pastries prepared with powdered yavam, barley and mass, which is used in the Kapha Yoni Vapat. Pastries prepared with the pipali, marich, mass, shatahava, kushtha, rock salt, used in the Kapha Yoni Vapat. So these are just examples of the vartis, that is pastries. We prepare the pastries first by using various methods of our drug preparation of Ayurvedas. Then we introduce into the vagina of that patient for the treatment of various Yoni Vapadas. Then third, Yoni Dhavan or Yoni Parishik, that is vaginal douche. With some examples of drugs, with decoction of Aragvadadi group of drugs, with decoction of Karir, Dhava, Arka, Venu, we used in the Unistrav, with decoction of Triphala, we used in the Unistrav, with decoction of Guduchi, Triphala, we used in the Yoni Kandu, with decoction of Rajas Travaksadi group of drugs, we used in the Yoni Pechilya, with decoction of Tubarak, we used in the Yoni Dorgandhya. Then next, Yoni Dhupan. Dhupan is nothing but the fumigation, that is fumigation of vagina with medicated smoke. So here are some examples again. Fumigation with Haridra and Brahati, used in the Yoni Kandu. Fumigation with Saral, Gugul and Ghruta, used in the Shvetapradar. Fumigation with Krishna, Sarpanirmukh and Kattu Alabu, used in the Garbhasangam. Fumigation with Kushtha, Gugalu, agar mixed with Grita, used in the Sutika Paricharya. Then the next one, that is Yoni Lepan. What is a Lepan? That is vaginal painting. Here some examples are there. With powder of Palash Beach and Udumbar Palak mixed with Til Tel and honey, used in Vivrita Yoni. Then with the powder of Makkan Fal mixed with honey and Kapur, used in Vivrita Yoni. With powder of burnt broken earthen pots and Triphala, used in rice Yoni Vapadas. Then next, Yoni Puran. Yoni Puran is also the vagina packing. With fat of bear, crab or cock medicated with Madhur group of drugs, Mahayoni. With Vesavar, used in the Prasal Yoni. With Khadir, Pathya, Jati Fal, etc. Used for the Yoni Puran. Then next, Yoni Uttarbasti, which is a very important part. All of these Sthanik Chikitsas we are using in the Yoni Vapadas, but the most important is the Yoni Uttarbasti, which we used in various Yoni Vapadas. What is the Yoni Uttarbasti? Yoni Uttarbasti is medicated oil or decoction, which is pushed into the uterine cavity through vagina. Some examples are Guduchadi Tailabasti, that is in the Vata Yoni Vapat. Madhuk Shir Siddhabasti in Pitta Yoni Vapat. Basti with the oil medicated wheat Jivaniya group of drugs in the Kapha Yoni Vapat, etc. So these all are the examples of the drugs which we used in the various Sthanik Chikitsas. Now I'm going to explain the mode of action of Sthanik Chikitsas. that is Yoni Pitsu Sthanik Chikitsa mode of action, Yoni Varti mode of action. Like, so Yoni Pitsu, what is the mode of action of Yoni Pitsu? Pitsu helps the medicine to remain at the site for a longer period for better action. In Yoni Pitsu, that is, we use a tampon, so prepared by the various oils of our Ayurveda drugs or decoction, which we mixed in that pitsu, and then it will remain in the vagina to give its proper action in the vagina for its better action and for a longer period. The mode of action depends on the medicine used, as different medicines have different mode of actions. For example, the sesame oil base is most commonly used and it has antiseptic and antibacterial properties. The pitsu used during pregnancy and labor helps to soften the vaginal canal for easy delivery and easy expulsion of placenta. This is Yoni Pitsu. Then next, what is the mode of action of Yoni Varti? Yoni Varti is nothing but the pessaries. Most of these Yoni Vartis and pessaries played the role of the antibacterial, that is bactericidal properties, antiseptic properties, which fights against all of the infection of the vaginas, infection of uterus, etc. So Varti is a prolonged and long lasting. Varti can be used effectively in infections and delaying their occurrence. Yoni Varti helps to clear the vagina and also provides the opportunity to recreate the optimum vaginal health. Then third one, that is Yoni Dhavan. What is the Yoni Dhavan? Yoni Dhavan is vaginal douche. Just we use the decoction of the drugs and we use to wash the vagina or the external part of the vulva or the labia majora, that is external female genital organs. Some of the times we used to wash the internal genital organs also, up to the cervix. Yes, ma'am?
Dr. Amrita, you are exceeded the time limit. Please speed up.
Yeah, ma'am. Just 2 minutes only. Then Yoni, this is the Yoni Dhavan. It's a procedure of cleaning to vaginal zone and sedated oils are utilizing for such a movement. Okay. Then it is nothing but the sanitizing procedure. Then Yoni Dhupan. Yoni Dhupan I have already explained, that is nothing but the fumigation. Medicines which are used in the form of smoke by burning of it is called as a Yoni Dhupan. It is mostly done on the wounds, a part of the body or on the whole body depending on the need. Then Yoni Lepan. Lepan is just an application, like local application used in the allopathy. In Lepan, the drug penetration is higher on the vagina. Then Yoni Puran. What is the Yoni Puran? Yoni Puran, it's involved filling of the vaginal cavity using powders, paste and medicated oils. You just use that powders, paste, creams, etc. in the Yoni Puran, in the process of Yoni Puran. Then Uttar Basti. Uttar Basti removes the Srotas Gandha and corrects the Artavagni, which regulates the menstrual cycle, thus resulting in the ovulation. And there are so much properties of the Uttar Basti, but because of short period of time, I can't explain this. Conclusion. Thus, we conclude that the holistic approach, Sthanik Chikitsa of Ayurvedic system of medicine gives completely relief to the patients from Yoni Rogas. Sthanik Chikitsas in Sri Roga and Prasuti Tantra are very encouraging. Medicines used in the above case are cheap, effective, and easily available. Each Sthanik Chikitsa holds its own importance and shows marvelous results when it is applied with the proper indications and with aseptic precautions. References. These are the references where I have taken all of this information. Thank you.
Thank you, Doctor.
Thank you, Dr. Amrita.
Thank you, sir. Thank you, everyone.
Next, I invite Dr. Shanika Abhay.
Good evening, ma'am.
Good evening, Doctor.
Doctor, please share the screen, Doctor.
Yes, ma'am. Yes, sir. Just a second, ma'am. I'm trying to share.
Okay, Doctor.
Can you please share the screen, sir?
Sure, Doctor, I'll share for you. Please start the session, Doctor.
Thank you so much. Good evening, all. Myself, Dr. Sanika Abhay Virkar. The topic of my presentation is Basti, Gateway to Retinal Disorders Management. Most of the systemic conditions like hypertension, diabetes shows ophthalmic manifestations on retina having symptoms like floaters, visual field defects, visual impairments. These symptoms can be correlated with Vata Jnanatmaj Vyadhis mentioned in Ayurveda, that is Timir. As we all know that Basti Chikitsa is considered as the best treatment for Vata dosha. Hence, Basti can be used in the management of retinal disorders. Nowadays, anti-VEGF injections are used to treat the retinal disorders. These injections are invasive, local in action, and having many complications. In the other hand, the Basti, that is the Ayurvedic treatment, is non-invasive in nature, having systemic action. It penetrates the blood retinal barrier and it has lesser complications. Vata along with Pitta and Kapha, that is 3 dosha, Sapta Dhatu, and 4 Abhyantar Patalas are involved in the visual process. Basti Chikitsa can be administered in the Urdhva Jatrugata Vyadhis. According to Sushruta, Basti acts as Sanshodhan as well as Sanshamana. In the shloka, Chakshuhu Prinayati indicates the efficacy of Basti reaches to eyes, penetrating the blood retinal barrier. So, it can be advised in the vascular and neuronal disorders of eyes. Disease-specific action of Basti can be understood by studying the dosha dhatu and sroto dushti associated with it. Next slide, please. When a patient comes to our OPD with hemorrhages, exudates, microaneurysm, and capillary leakage-like symptoms, we term that disease as diabetic retinopathy or Madhumeha-janya Patalagata Roga. Next slide, please. So, according to the stages of diabetic retinopathy, Basti Chikitsa can be administered. In mild to moderate non-proliferative diabetic retinopathy, Panchatikta Niroha Basti can be administered, which is mentioned in Charak Siddhi Sthana. In severe non-proliferative diabetic retinopathy and proliferative diabetic retinopathy, Madhutailik Chakshushya Basti can be administered. And in severe Dhatukshay Avastha, Sthiradi Niroha and Mustadi Yapan Basti can be administered. Similarly, in disease like age-related macular degeneration or Tritiya Chaturtha Patalagata Dosha Dushti, Basti Chikitsa can be administered. Next slide, please. According to Ayurveda, in ARMD or Tritiya Chaturtha Patalagata Dosha Dushti, Vata Pitta Shamak, Stroto Shodhak, and Rasayan Chikitsa is given. Along with that, we can use Vayasthapan Gana and Rasayan Dravyas to give Yapan Basti and Sthiradi Niruha Basti, which gives good results in age-related macular degeneration. Most commonly found patients are retinal vascular occlusions, venous occlusions or arterial occlusions. In such condition, to avoid in the hemorrhagic stages in Rakta Pitta Avastha, Rakta Pitta Shamak Dravyas or Tikta Rasa Dravyas can be administered via enema or basti to get good results. Next slide, please. Probable mode of action of basti according to Ayurveda can be understood via this picture. Next slide, please. When basti is administered in Pakvashaya, it brings the dosha and mala from all over the body, from foot to toe by virtue of its virya. Further, it activates the vayu through sira. The cumulative effect on body includes the chakshurendriya. So, this physiology proves the extensive action of basti dravya and relation of basti, that is colon, with the central nervous system. The probable mode of action according to modern can be understood by 4 mechanisms: absorption, system biology, neural stimulation, and excretory mechanism. Absorption. The hyperosmosis takes place, which leads to absorption of endotoxins. Next slide. The action of basti dravyas can be better understood in this chart. Basti is prepared by using saindhava, honey, oil, or ghee. The Saindhava changes the tonicity and facilitates the rapid absorption of drug. Honey makes the solution colloidal, and Saindhava or oil or ghee makes it lipophilic in action. The system biology mechanism acts by absorption in the intestinal mucosa via passive and active diffusion. Next slide, please. The neural stimulation mechanism acts when the drug simulates the ENS, which excites the mesenteric plexus and submucosal plexus, which leads to the CNS action independently via the anal or enema administration. Last step is excretory mechanism. They are mainly stimulated the action and functioning based on the defecation reflex. So understanding these four mechanisms on modern terminologies and understanding the Ayurvedic concept, we can conclude that functioning of Vata dosha and nervous system can be considered as similar. Basti being the best remedy for Vata, it is effective on nervous system, including the retinal and optic nerve diseases, which can be effectively used in management of vascular and neuronal disorders of eyes. The route of administration of Basti is via rectum. So, large surface area for drug absorption is available. Unpalatable tiktadi rasatmak dravyas in large doses can be administered via Basti without a hitch. Further clinical trials on less explored Basti chikitsa may prove new gateway for management of retinal disorders. Thank you.
Thank you, doctor.
Thank you so much.
Next, I invite Dr. Sharon John. I invite Dr. Sharon John.
Dr. Sharon, are you there? Next, I invite Dr. Devika CS for the paper presentation.
Okay,
Dr.
sir.
Devika?
Yes, no, sir.
Please share the screen, doctor. Your voice is breaking, doctor.
Okay, now it's clear.
Now it's clear, doctor.
Hello. Okay, sir. Thank you. Sir, wait, I will share my screen. Is it visible?
Now it's sharing, doctor. Now it's visible, doctor. Your screen is visible. Please start the
Yes.
session, doctor.
Yeah. Okay. Sir. Myself, Dr. Devi, PG scholar from the Samhita Department of Amrita School of Ayurveda. My topic is about an overview of Siddhanta and applications. The contents of the slides are introduction, derivation, definition, types of Siddhanta, discussion, conclusion, and references. Sir, can I audible?
Yes,
Yes,
doctor,
doctor,
please
you're
continue.
audible.
Is it audible for a...
Yes,
okay.
yes, doctor.
So the introduction means Siddhanta plays an important role in theoretical and practical aspect of Ayurveda. And the Siddhanta is one of the Vadamarga as mentioned by Acharya Charaga in the 8th chapter of Vimanasthana. The chapter name was the Rogabhishakjidiya Adhyaya. It is also described in Nyaya as one of the Shodasha Padartha. Next, the word Siddhanta is derived from the Siddh Antaha Yasmat, which means something that is decided upon. By Shabda Kalparuma says that Purva Reksha Shirasya Siddha Paksha Stabhi, which means the one which is obtained or established as a result of questioning or inquiring. The derivation of the word Maulika by Shabda Kalpadruma means Mule Bhavadi Mauligam, Urta Mula Madaha, Shaga Mule, Adhiye Jadaha. The word Maulika means that which is related to the root or the origin and is in the pure form. The Mula is always superior to the Shaga. Thus, the Maulika Siddhanta are the basic principles of Ayurveda science. Then we move to the definition of Siddhanta. It given by Acharya Charaga in the 8th chapter of Vimanchana, Siddhanta namo sa yaha parikshe bahuvidam parikshya hedubhishta sadhayitva stapyati nirnayaha, which means the principle known as Siddhanta in Ayurveda signifies that which is valid and true, means with the theory which is accepted by all. Then by Nyaya Sutra says that Pramanikattvena abhyugade artha Siddhantaha. The Nyaya philosophy defines Siddhanta as the subject accepted after being validated through various evidences. Then the Siddhantas are of 4 types. Sa Chadurvidaha, Sarvatantra Siddhanta, Praditantra Siddhanta, Adhikarana Siddhanta, Abhyugama Siddhanta, Chedi. Then first we move to the Sarvatantra Siddhanta. Tatra Sarvatantra Siddhanto Nama, Tasmin Sarve Tasmin Tandre, Tat Prasiddham. Yada Sandhi Nidanani, Sandhi Vyadhyaha, Sandhi Siddhyubhaya, Sadhyana Nidhi. The Siddhanta is approved by all the treaties is Sarvatantra Siddhanta. For example, the existence of causative factors of diseases and the existence of curative for all curable diseases. By Nyaya Sutra defines that Sarvatantra Viruddhas Tandre Adhikruto Artha Siddhantaha. The one which is not opposed by any school and which is approved by all unanimously is called as Sarvatantra Siddhanta. This includes Panchamaha Siddhanta, Rogarogi Pariksha Siddhanta, Ayu Siddhanta, Doshadadu Mala Siddhanta, and Agni Siddhanta, etc. Then this table shows the examples of Sarvatantra Siddhanta, means all accepted by Charagacharya, Susrudacharya, and Ashtanga Hridaya. Then next we move to the Praditantra Siddhanta. Pradanta Siddhanto Nama, Tasmin Anegesmin Tandre, Tat Prasiddham. Yada Anyatra Ashtav Rasaha Shadatra, Panjendriya Nyatra, Shadindriya Nyatra Tandre, Vadadi Kridaha, Sarvi Vigara, Yada Nyatra, Atra Samana Tandra Siddha, Paratantra Siddha, Praditantra opposed by the schools in opposition. Thus suggests one Acharya or the treatise to other, as is the organ to develop in the fetus. And this was the
Hello, Dr. Devika. Hello, Dr. Devika, can you hear me? Hello, Dr. Devika, can you hear me? I think it was some network problem. Next, I invite Dr. Rumi Tandugar for the paper presentation on the topic Dhadumala. Dr. Rumi, are you there?
Yes, sir. Am I audible?
Hello, doctor.
Hello. Hello.
Doctor, your voice is very low, doctor.
Hello. Hello.
Yes, it's okay, doctor.
Am I audible to you?
Yes.
Shall I start my presentation?
Yes, doctor.
Can you see my screen?
No, it's not visible, doctor.
now it's visible, ma'am.
Okay. Okay.
Is this
Hello?
Dr. Rumi or Dr. Devika?
It's Dr. Rumi.
Dr. Rumi,
Okay.
it's not
Yes.
visible.
Ma'am, Myself, Dr. Devika. So my presentation.
Doctor, please
Devika, we
speak
will
now.
call you next, doctor.
Okay.
Dr. Rumi, please continue. Doctor, your screen is visible. Please continue.
Okay. Namaste. I am Kavala, pioneer business scholar, Department of Shani, Government College, Kannur. So my presentation is Dhatu Mala. As we know that Dhatu are the entities which support and nourish the body, and properly it is very essential. So food is among pillars of the body, and it has to be properly digestion and formation of healthy Dhatu is the Ahara Parinam. So the actual Natrag converts into Sara and Pitta portion, and this Prasada Bhag will be Annarasa and Pitta Bhag, which will produce Purisha and Mutra on and maintained in its normal state by its action of Dhatuvagni situated each Dhatu. So Dhatuvagni residing in Rasa Dhatu will be acted upon by the Annarasa and results in the production of Prasada Amsa and Kitta Amsa. From this Kitta Amsa will form the Dhatu Mala. So with definition of Mala, as we know that which is cleared out or purifies the body is mala, and which pollutes other structures of the body. So as it is very important dosha dhatu.
Hello, Dr. Rumi.
Dr. Rumi.
Dr. Rumi, can you hear me? Please unmute, doctor. You are in mute. Please unmute, doctor. Dr. Rumi, please unmute the audio, doctor.
Hello.
Okay, doctor, you are audible. Please continue, doctor.
Hello. Yeah, I did already. Hello. Okay. So I was in the hello.
Hello, doctor, you are audible, doctor.
You're
Please
audible.
continue.
Please continue.
Okay. So we are here in the importance of mala. So it has been mentioned in the Charak Samhita Chikitsa Sthana in case of Rajakshama. As in this condition, there is reduced Jataragni, so most food substances become waste products. So eliminated out and very little amount is contributed for the formation of ojas. So in this condition, there is depleted with all tissue elements and strength. So in case of importance of mala, it has been advised to avoid excess defecation as it is the only source of strength. So, and the kitta, that is mala, is the waste products in general, while kitta is to be discarded, that which is formed after a paka, generally referred to as waste products of the dhatu. So, classified as two here is brihat mala and the chudra mala. So, dhatu mala comes under the chudra mala, which has been described by all Vyadhis and Sarangara. So when dhatu undergoes paka by the dhatu agnis, produce their mala. So dhatu paka and which yield base product kitta. So this chart shows the function of dhatu and different vatus and the. So it has described various acharyas according to Chakshushya commentary in the Samhita. Chart shows the different dhatu mala. So for the rasha do
Dr. Rumi.
Dr. Rumi, are you there? Okay, next I invite Dr. Parag for the paper presentation on the topic an observational study of relation between Vyadhis and Marma. Dr. Parag, are you there?
Am I audible, sir?
Yes, Doctor. Audible, Doctor. Please share the screen, Doctor.
Am I audible, sir?
It's audible, Doctor.
Okay. Just a second, sir. I'm sharing my screen.
Okay, Doctor.
My screen is visible, sir?
Yes, Doctor. Is visible. Please start the session, Doctor.
Okay, sir. Thank you, sir. Hello. Good evening, all of you. My name is Dr. Parag, MD Scholar, Rajnashari Department, Bhausai Mudok Ayurvedic Mahavidyalaya, Nagpur. I'm here to present. My title is an observation study of relation between Vyadhis and Marma. Here is the introduction. Acharya Shushruta described Vyadhis after describing Marma. Nomenclature of Vyadhis and Marma were same, indicate that both has a close relationship between them. Available literature of Vyadhis includes only name of Sira and its classification as per the Shadanga Sharir, but lacks of the consequences happened after their Vidya. I tried to find relation between Marma and Vyadhis in this study. The name of some Marma and the name of Vyadhis were same. Example, Urvi Sira, Urvi Marma, Lohitakshu Sira, Lohitakshu Marma, Bruhati Sira, Bruhati Marma. Number of Vyadhis were named as Marma, Sthanagata Sira. Example, Vitappa, Katika Taruna, Pashva Sandhigata, Rudegata, Stanamula, Stanarohita, Apastamba, Appalap, Krukatika, Vidur, etc. Here is some reference. Chaturvidayastu Sirah Sharire, Prayena Tamarmasu Sanvishta, Snayavya Asti Mansani, Tatheva Sansdhinasta, Santarpai Deham Pratiyapayanti. Shushushari Stan 6/18. Sira at near Marma nourishes the body and maintains the integrity of body. This is the basic reason behind the Sira and its place. Here is the aim and objectives. The aim is a study of relation between Vyadhis and Marma, and the objective is to study the Marma, Adhisthan, and related Vyadhis, to study the Vidya Lakshana of Marma and related Vyadhis. Here is a material and methods. Literature study of Shushruta Samhita, Sharistan, literature study of Pratyeka Marma Nidesh, Sharirupakrama, literature study of Siravid, Sharirupakrama. And here is some observation which I taken from the references and various Sahitas. The observation of relation between Vyadhis and Marma with its Adhisthana. Vyadhis related Marma and Marma Praman and Marma with the Lakshana in this table. The Jaladhara, the related Marma is Kurchashair, Marma Praman, Vanangul, Marma with the Lakshan, Ruja and Shof, Urvi, related Marma Urvi, Marma Praman Vanangul, and Marma with the Lakshan is Shonitakshay and Saktik Shosh. Lohitaksha, related Marma is Lohitaksha, Marma Praman, half Anguli, and Marma with the Lakshan is Lohitakshay and Pakshagat. Vyadhis then Vitapgat, related Marma is Vitapa, Marma Praman is Vananguli, and Marma with the Lakshan is Shandhya and Alpakshkrata. Then Vyadhis Katika Taruna Kata, related Marma is Katika Taruna, Marma Praman half Anguli, Marma Vidya Lakshana, Shonitakshay, and Pandu. Urdhva Pashvastha, there is no related marma and no pramana mentioned, and also marma Vidya Lakshana is not mentioned. Then Parshva Sandhikat, related marma is Parshva Sandhi, marma praman one angul, and marma Vidya Lakshana is Lohita Purana. Koshta and then Mrityu. Then next Avedesira is Urdhvagami. Then next Bruhati, related marma is Bruhati, marma praman is half angul, marma Vidya Lakshana is Shonita Pravritti or Mrityu. Then Medo Pari, then Rudayastha, Rudaya, marma praman is 4 angul, Sadhya, and then marma Vidya Lakshana is Sadhya Marana. Avedasira, then next is Stanamulastha, Stanamula, marma praman is 1 angul, marma Vidya Lakshana, Kapha Purana Koshta, and then Mrityu. Avedasira, Apalapastha, Apala, marma pramana half angul, marma Vidya Lakshana is Rakta plus Puya. Then Avedasira Apastambastha, Apastamba, half angul, Vatapuran Koshta, Kasa, Shwasa, and then Marana. Matruka Sira, related marma is Matruka, marma pramana is 4 angul, marma Vidya Lakshana is Sadhya Marana. Then Nila, marma related is Nila, marma pramana is 4 angul, Mukta and Swara Vikruti, Arsha Grahana. Then Manya, related marma is Manya, 4 angul praman. Then marma Vidya Lakshana, same as above. Then Krukatikastha, the related marma is Krukatika, half angul. Marma Vidya Lakshana is Chalamurdata. Then Ardhasira, Vidurgat, related marma is Vidur, marma pramana half angul, marma Vidya Lakshana is Badhirya. Then Hanustamba. Avedisira, next Avedisira Rasavahi, Bhagvahi, Apunakastha, Talustha, Apanagastha. The related marma is Apanga, and marma pramana is half angul, marma Vidya Lakshana is Andhya and Drushti Vikruti. Then Shabdavahini, then Keshantangushta, Avartastha, related marma Avarta, marma praman half anguli, Andhya and Drushti Vikruti. Then Stapani, related marma Stapani, half angul pramana, Jivetas, Shalya. Then yes, Shankhadigat, marma related is Shankha, marma pramana half angul, marma Vidya Lakshana, Sadhya Marana. Then Ukshepa, related marma Ukshepa, marma pramana half angul. Then Lakshana is Jivete Shalya. Then Simantastha, related marma Simanta, 4 angul, Unmad, Bhaya, Chintanash, and then Mrityu. Then Adipastha, Adipatishta, related marma Adipati, half angul, and Sadhya Marana. It is reason, according to the above observation, the whole length of the Sira is not Avedha, but it is the Avedha at marma place within a marma pramana. The Sira present at the site or near to marma, Adhisthana, maintain the integrity of marma, pranayatana. Hence the Ved of Vedya of Avedha Sira were unable to maintain the integrity of marma structure, and marmagat lakshanas were developed. Here is a reference, and the conclusion is there is a close association between Avedya Sira and marma. Avedya Sira maintains the integrity of marma, Adhisthana. Then marma Vidya Lakshanas are also the Avedya Sira Vidya Lakshana. Here is some references. Thank you.
Thank you, Doctor.
Thank you, Doctor.
Thank you, sir. Thank you.
Next, I invite Dr. Grishma K for the paper presentation on the topic A Comprehensive Review on Gridrasi. Dr. Grishma, are you there? Hello, Dr. Grishma, are you there?
Yes, sir.
Please share the screen, Doctor.
Is it visible, sir? Hello?
No, Doctor, not visible.
Is it visible now,
Now it's visible, doctor. Please start the session.
Sir? Okay, thank you. Karma, Karnataka Ayurveda Medical College, Mangalore. My topic is a comprehensive review on Gridrasi. Hello.
You are audible, doctor. Please continue.
Coming to abstract, Gridrasi, sciatica is one of the severe debilitating syndromes, Tolda, Stamba, and more Spantana in this week. Kadi, Prishta, Uru, Janu, Janga, and Pata. Low back region and radiating down towards the foot. This is a common entity encountered in a clinical practice. The review elaborates the general description of disease Gridrasi with respect to sciatica, the general principle of treatment and procedures for the management of Gridrasi or sciatica. Gridrasi is a Vata Vyadhi in which the Gamana it simulates the walking style of Gridra, that is vulture. Lifestyle and experience pain primarily in the Svik Pradesha, which later radiates to Kati and to left through the posterior aspects of Uru, Janu, Janga, and Pata, where the patient finds difficulty in extending the leg. Atyadva, Adhyana, Vyayama, Vyavaya, Dhavana, Pidana, Plavana, Bharavahana, etc. some of the major causative factors for this disease. Identical to this, sciatica is characterized by low back ache radiating down to legs and Gridrasi. In the practice of conventional medicine, the treatment of sciatica is limited to analgesics, anti-inflammatory drugs, physiotherapy, as well as surgical intervention in extreme cases. Various treatment modalities like Snehana, Svedana, Virejana, Basti, etc. are said to be efficacious. Even specific treatments like Siravya, Agni Karma, Basti, etc. are also emphasized. Many Shamana yogas are mentioned in our classics, which are proved to be efficacious. The symptoms such as radiating pain, numbness, weakness, tingling sensation, and discomfort along the path of sciatic nerve are the results of compression, irritation, and inflammation of the sciatica nerve, which is termed as sciatica. And coming to review on Gridrasi, Vyutpatti, term Gridrasi is derived from word Gridra. Gridra may be identified as vulture. The bird is fond of meat and he eats flesh of an animal such a fashion. Such type of pain occurs in Gridrasi and hence the name. Coming to Nirukti, Gridra Ama Pishyati, Syati Akshapana. Gridramiva Syadgachat. Gridrasi is said to cause an abnormal action in the affected leg. By this abnormality, the gait of the patient has a resemblance to the gait of bird vulture. According to Shabdakalpadruma, the word Gridra refers to a person who is crazy of eating meat. The word Pidyati in Sanskrit means to cause suffering. Thus, the word Gridrasi applied to an illness who has high consumption of meat. Coming to Paryayas, Ringini, Randrini, and Radina are Paryayas of Gridrasi. Coming to types of Gridrasi, according to Acharya Charaka, Harida, and Madhavakara, Bhava Prakasha, they mention two types of Gridrasi, that is Vataja and Vata Kapacha, whereas Acharya Sushruta and Vakvada have not mentioned any classification of Gridrasi. Coming to Nidana, Gridrasi is considered as an Anatmaja type of Vata Vyadhi. The provoking factors of Vata can also be taken as a cause of Gridrasi. All the etiological factors given either of Vata Vyadhi or Vata Prakopakara in the Ayurvedic classics can be classified into following. Aharataha, excessive and continuous intake of Kadu, Tikta, Kashaya rasas will increase Vata, in turn causing Gridrasi. And Viharaja Nidanas are Adi Plavana, Adi Prapatana, Adi Prapidana, Adi Vicheshtana, Adi Vyayama, Adi Chalana, increases Ruksha Guna, in turn increasing Vata and causing Gridrasi. Kalaja Nidana or Visheshna of Vata take place in Ridus like Varsha, Grishma, and Shishira. It also increases in Aparana Kala, Jirna Kala Aparanta, and Jaravastha. Jaravastha is the degenerative age which plays major role to cause degenerative changes and causing Gridrasi. Manasika Nidhanas are Bhaya, Shoga, Krodha, Chinta. and in turn causing increase in Ruksha Guna and thereby contributing to Gridrasi. Akantuja Nitanas are Agada to Marma due to Bahya Karana can be considered as Akantuja Nitanas. And Purva Rupa. There is no description regarding the Purva Rupa of Gridrasi, but Gridrasi is a Vata Vyati and Avyakta Lakshanas are Purva Rupas of Vata Vyatis. And according to Chakrapani, commentary on Avyakta, few mild symptoms are to be taken as Purva Rupa. Gangadhara has given similar opinion to that of Chakrapani, but according to Madhukosha Vyakya of Madhava Nitana, the symptoms which are not exhibited clearly are Purva Rupas. Vague low back pain, mild discomfort in the lower extremities, altered sensation in the legs, and similar other symptoms of Gridrasi, and its minimal severity may be considered as Purva Rupas. Coming to Rupas, there are Samanya Lakshanas and Vishesha Lakshanas. Samanya Lakshanas are these clinical manifestations are seen in both Kavala Vadhas and Vada Kaphaja type of Gridrasi. They are Ruk, Toda, Stamba, Mur Spandana, Saktikshavana Nigraha, and Kadi Uru Madhya Bahuvedana. And Vishesha Nidhanas will be according to the dosha involved. Coming to Samprapti, for Gridrasi, Samprapti has not been mentioned separately. Since Gridrasi is a Vatavyati, the general Samprapti of Vatavyati is considered here. In Gridrasi, exposure to mild and continuous trauma to Kati, peak region because of improper posture, traveling in uneven roads, carrying heavy loads, digging, spinal cord injuries is responsible for producing Sthana Samstraya Kati, peak Prishta. They may not be able to produce the disease at the instance, but after acquiring some Vyanjana Hedu, the disease may be produced. Here, based on Nidhana, Samprapti takes place either by Dadukshaya or Marga Varoda or Agantuja. In the state of Dadukshaya, all the Dadus subjected to Shaya. Due to Rukshadi Aharas, the Rasa Dadukshaya take place leading to Dadukshaya of Mamsameta, Asti Majja, etc. This Dadukshaya results in the aggravation of Vata, and this vitiated Vata fills up the empty sources, causing Vata Vyadhi. The second type of Samprapti take place by Marga Varoda. Here, Kapha is Anugandhi Dosha along with Vata. Adipojana, Divasapna, etc. are the factors responsible for this kind of Samprapti. Agnimantya also causes Vata Gutrasi. Samprapti Gataka, Nitana is Vata Prakopakara Nitana, Dosha is Vata and Kapha, Vyana Vayu, Shapana and Ukshapana, Apana Vayu, site is Kati, and Sleshmaka Kapha resides in Santi. Dushas are Rasa, Mamsa, Rakta and Snayu. Ruk and Stambhana of luck, inability of walking, Mamsa, Arojaka and Gaurava, Rasa Dhatu, Toda, Tvak and Rakta, radiating from buttocks to heels, that is Snayu. Agni involved is Jatarakni and Dhatu Agni. Ama is Dhatu Agni Janita Ama or Jatarakni Janita Ama. And Udbhavasthana is Pakvashya. Sancharanasthana is low back region to heel. Adhisthana is Pik, Kati, Uru, Prashta, Janu, Janga, Pada and Anguli. Shrotas is Rasa, Rakta, Mamsa, Meta, Asti, Majja. Shodhodushti, Sangha, Marga, Varota, and Roga Marga is Madhyama. Swabhav is Ashukari or Chirakari. Sadhya Satyaka. According to Acharya Susruta, has considered the Vata Vyadhi as Mahagata due to its tendency to be fatal and incurable. It is a Maharoga. Vata Vyadhi generally is difficult to cure. There is no separate prognosis mentioned regarding the disease Gridrasi. On the basis of prognosis of Vata Vyadhi given by Charaga, it can be said that Gridrasi in which the vitiated Vata is seated in Majja Dhatu is accompanied with the Kutha Vata, that is Vata Rakta, Anga Shosha and Stamba, which may or may not be cured even after careful treatment. But if this condition occurs in a strong person, is of recent origin and without any association of diseases, this is curable. A patient of Vata Vyadhi, if develops the complication like Shuna, Supta Vachana, and Vacha and pain in internal organs, then he does not survive. On the foreside mentioned descriptions, it can be said that Gridrasi is difficult to cure due to its Vatacha type of disease, which arises with complication. Coming to Bhadrava, Pranakshaya, Mamsakshaya, Jara, Tisara Moksha, Krishna Hikka, Chardi and Shwasa, Shodha, Suptada, Bhagna, Kampa, Atmana, Andaruja are the Bhadrava of Vata Vyadhi. Coming to Chikitsa, Chikitsa aims not only in the removal of causative factors, but also Shamana. They are Snehana, Svedana, Vamana. Generally in Vatacha disorders, Vamana is contraindicated, but Chakrapani and Bhava Mishra indicates Basti Karma, specifically for Gridrasi Chikitsa. Further, Chakrapani explains that without Shodhana, Basti Chikitsa is not beneficial. And Viresana, Basti, Siravyatana. Charaka explains Siravyata at the site of Antara Kantara Gulfa. And Acharya Sustruda and Vakbata, Siravyata 4 angulas above and 4 angulas below the knee joint. Moksha.
Doctor?
Karma.
Dr. Grishma?
Hello?
Speed up the presentation.
Hello? Doctor? Okay.
Doctor?
Okay. Sure. Patya, being a Vata Vyadhi, the Patya mentioned for Vata Vyadhi should be followed. That is Aharaja, Annavarga, Kulatta Masha, Palavarga, Amla, Rasevta Phala, Shaga Varga, Dukta Varga, Shira, Grita, etc. Mamsvarga, Jangala Phala, Jangala Pashupakshi, Taila Varga, Tila Taila, etc. Coming to Apatya, Aharaja, Kalaya, Chanaga, Kanguni, etc. Viharaja, Vegadharana, Vyavaya, Vyayama, etc. Coming to conclusion, all the Ayurvedic classics have mentioned describing the Vyadhi, Gridrasi. The disease Gridrasi is described as Vataja and Anatmaja Vyadhi. As Gridrasi is a Vata Vyadhi, so through Vatahara medicine and Panchakarma therapies, this disease can be managed. Gridrasi is a painful condition and so far there is no established therapy. Gridrasi can be correlated with sciatica in modern medicine. Abhyanga with medicated oil followed by Swedana may be used as first line of treatment for both types of Gridrasi. Agnikarma and Rakta may be useful in severe painful condition and in chronic degenerative conditions. Basti therapy may be better choice for the management of Gridrasi. Nidana Parivartana may stop the further progression of the disease. It may be concluded that various treatment modalities present in Ayurveda vary according to the condition of the disease present. Thank you.
Thank you, Dr. Grishma.
Thank
you. Next, I invite Dr. Devika CS for the paper presentation. Dr. Devika, are you there?
Yes, sir, I'm here. Can you hear me now?
Yes, Doctor. Please start the session, Doctor.
Sir, can you share my slides? Okay, sir. So, sir, third type of Siddhanta. Okay, sir. So, the third type of Siddhanta is Adhikarana Siddhanta. It's mentioned by Charagacharya is Adhikarana Siddhanto Nama Sa Yasmin Adhikarane Prastoya Mane Siddhanyanyapyadhikaranani Bhavandi Yeda Na Bhukta Karmanubandhigam Kurude Nispruhatvat Idi Prastude Siddhaha Karma Phala Moksha Purusha Pretya Bhava Bhavadi. The truth implied from a given context. For example, the inaction of the liberated soul suggests that there is existence of the action, their result and rebirth. By Nyaya Sutra, Yasmin Siddhanta Prakarana Siddhi, so Adhikarana Siddhantaha, the one which when accepted leads to the acceptance of the tenets. Similarly, the sutra says that Na cha tulya guno dushyo na dosha prakriti bhavati. This sutra pertains to the conditions of curability of a disease as the dosha and prakriti should not be the dosha. This sutra clearly mentioned the condition of curability of disease also implies that there is existence of disease which has certain conditions of curability, incurability based on entities of body which dosha, dusha, prakriti, etc. The Siddhanta having implied or inferred valid topic subject is termed as Adhikarana Siddhanta. Sir, next slide. Next slide, sir. So this table shows the concept of Adhikarana Siddhanta. I'm already mentioned. Then next we move to the fourth type of Siddhanta. Sir, next slide. Next. Okay. Abhyugama Siddhanta. Abhyugama Siddhanto Nama Bhikshida Manabadishta Abhyugama Vadagali Abhyagachadi Vishajaha Pradhanamidhi Krutva Gurnamidhi Krutva Vakshamaha Veera Pradhanamidhi Krutva Vakshamaha. The truth taken for granted, it is neither proved by Pramana or reasoning. It is explained on the context of debate. For example, in the context that is guna, karma, vidya, etc. Then the Nyaya Sutra says that Abhirikshida Abhibhagama Tat Vishesha Parikshanam Abhibhagama Siddhanta. The one which is implied and is not declared as such but follows from the examination of the particulars concerning it. Therefore, it contradicts the definition of Siddhanta and should not be cleared as Siddhanta, but instead it is rightly placed as Siddhanta because it paved the way for the formation of Siddhanta. The untested theory or the hypothesis is tested, examined, and if found true becomes a Siddhanta. All the various opinions, questions of Ajara regarding a particular matter of debate are termed as Abhigam Siddhanta. Next slide, sir. Then we move to the discussion. The purpose of Ayurveda is Prayojanam Chasya Swasthya Swasthya Rekshanam Adurasya Vigara Prashmanam. To prove the purpose of Ayurveda, Samani Sarvada Sarva Bhavanam Samani Karanam Khasa Hetu Visheshascha Samani is essential for getting rid of disease. In case of Dhatu Vaishyama, the Dhadus get increased or decreased. The Samani Siddhanta explains any type of increment on the basis of Saman Dravya, Saman Guna Vishta, etc. As the same way, the Vishesha Siddhanta gives knowledge of any type of increment. For example, Adhistavya and Laguhara is advised in case of Adhikashya. Pratitantra Siddhanta knowledge is also very important, same as Sarvatantra Siddhanta. For Acharya Susruta mentions Siddhaveda is Ardha Chikitsa in Shalya Tantra. Acharya Charaka said that the Vasti is Ardha Chikitsa in Siddhisthana. Thus, the dependent Siddhanta described in text are known as Pratitantra Siddhanta, which are accepted irrespective and has equal importance. So next slide, sir. In Adhikarana Siddhanta, according to Acharya P.V. Sharma, Sadvitacharya is Adhikarana Siddhanta in Ayurveda text because the whole Sadvit was made by Guru Shukracharya for the Rakshas to keep the Rakshas disciplined due to decline of Dharmapat. It has been said in Ayurveda to discipline human society. So in present time, the step of research making a new theorem means that first we define the research problem or the new thought, then review of literature, then formulating the hypothesis, then preparing the research design, then data collection, data analysis, examination, interpretation, presentation or the result, and the synthesis of making new theorem or the principle. In ancient times, for making a theorem, they are adapted Aptodesha, then examined by Pramana, symposium or conclusion, and established the Siddhanta. Next slide. So, the conclusion is Siddhanta is one of the important concepts in any science. It can be taken as a base in conducting many research works like experimental, preclinical, clinical, etc. In today's world, there are many tools developed from which even the minutest organism can be visualized. With the help of these tools, an effort should be made to revalidate the Siddhanta mentioned in Ayurveda in new terms so that the Ayurveda is globalized and widely accepted. Next slide, sir. So, references from Charaka Samhita Tika and Charaka Samhita Ayurveda Padartha Jnana, etc. Thank you, sir. Thank you, sir.
Thank you, Doctor.
Thank you.
Next, I invite Dr. Tejaswini Prakash for the paper presentation. Sorry, it's a poster presentation. Dr. Tejaswini, are you there? Dr. Tejaswini, are you there? Dr. Tejaswini Prakash Harode, are you there? Next, I invite Dr. Sushma Shivapal for the paper presentation. Dr. Sushma Shivapal, are you there? Hello, Doctor. Dr. Sushma, are you there?
Excuse me, sir. This is Dr. Vivekanand. My time was 8:23. So can I join, please?
Okay, Doctor. Please start the session, Doctor. Dr. Sushma, please chat. Dr. Vivek, we will call you next, Doctor. Dr. Sushma. Dr. Sushma Shibal, we can't hear your voice, doctor.
Dr. Sushma, it's not audible.
Dr. Sushma, we can't hear your voice, doctor.
Doctor, now please unmute.
Dr. Sushma, please reconnect your headset, doctor. Okay, Dr. Sushma, we will call you next. Next, I invite Dr. Vivekanand for the paper presentation on the topic Rakta Mokshana in Shalya Vyadhis. Dr. Vivekanand, are you there? Hello, Dr. Vivekanand, are you there? Dr. Vivekanand Bhaumik, are you there?
Dr. Vivekanand, please unmute.
Yeah, I'm here only. Dr. Vivekanand there.
Okay, doctor. Please share the screen,
Yeah.
Dr. Vivekanand.
1 second. Only 1 second. As okay, can you see, sir? Hello.
It's visible, doctor.
Okay, sure. So, hello, myself, Dr. Vivekanand Bhaumik, from I'm doing my second year post graduation from Shalya department in SKMC, Kalabareshwar Swami Ayurvedic Medical College in Bangalore. So, my presentation is Rakta Mokshana in Shalya Vyadhis, and my guide is Dr. Vishwanath Sharma. So, the content of this is the introduction Rakta as a Chaturtha dosha of Rakta Mokshana, type of Rakta Mokshana, Parshanna, Shiraveda, Jaloka Charna, Shringa, Alabu, discussion, then conclusion. So, introduction. Rakta Mokshana is one of the important procedures carried out in various Shalya Tantra Vyadhis. It is one of the Shodhana procedure which expels the vitiated Rakta. This is according to Ashtanga Hridaya, Sutra Isthana, 14th chapter, 5th shloka. And so, Rakta is a Chaturtha dosha. Tadabhiro Shodi Chaturte, Sambhav Sthiti Pralay Virahitam Shariram Bhavati. The three doshas, along with the Shonita, the fourth are present during the origin, existence, and destruction of the body. Narte Deha Kafa Dasti na Pittana cha Maruta, Shodita Dapi va Nityam Deha Etastu Dharyate. The body never exists without Kapha, Pitta, Maruta, and also Shonita. The body is supported by these. Even dosha Chid Ekasho Vidisha Samasta Shodita Sanhita va Anekada Prasaranti. Dosha prasara happen either individually, in combination of 2 or 3 doshas, or in combination with Shonita. Kapha Vatajit Praya Pittam Shodit Mevava Yadi Kupyati Vatasya Kriyamade Chikisate Tathol Badash Dosha Se Tatra Karyam Chikjitam. When Kapha, Pitta, and Shonita are vitiated, while Vata is under control, respective Kriya has to be done for treating the aggravation. Kapha, Pitta, and Shonita Mokshana. So these are a few pictures of Rakta Mokshana. Like first one is Shiraveda, then second Alabu, third one Jaloka, then Shringa. Raktasya Mokshanam, Rakta Mokshanam, letting out blood for therapeutic use is called as Rakta Mokshana. So what is the importance of Rakta Mokshana? Twak dosha granthya sofa roga shodit jas chahiye Rakta Mokshana shila nam na bhavanti kadachana. In people who undergo Rakta Mokshana, Twak dosha granthi, sofa, and roga due to Dushta Rakta will not occur. So among all the treatment method for Sadhya Rogas, Shiraveda is the best. Just like how the paddy and other crops die out completely by removing the burns of the peel. This procedure helps to eliminate the disease completely. When other treatment fail, Shiravida has to be done for Rakta Prakopaja Vikaras. Snehadibi Kriya Yogena Tatha Lepaneerapi Yantyashu Vyadhis Shanti Yatha Samyak Shiravida. The condition which do not subside with Sneha, Lepa, etc. treatment will subside with the proper Shiraveda. Rakta is the Adhisthana for all the Vikaras. There is no other Dushya like Rakta, hence Shiraveda is the first important procedure. Shiraveda Chikitsartha, Shalya Tantra Prakirtita. Shiraveda is considered as Artha Chikitsa in Shalya Tantra. So now this is the type of Rakta Mokshana. So we can divide it into two types, Shastra and Ashastra. Shastra is like a Prachana and Shiraveda. Ashastra, Jaloga, Shringa and Labhu comes under it. So consideration before Rakta Mokshana. So we have to inform the patient about the procedure, take the consent from the patient. Investigation like total count, differential count, hemoglobin percentage, clotting time, bleeding time, tender blood sugar, HIV, and SBSG we supposed to do. Then check blood pressure. Advised to stop thrombolytic medicine 2 to 7 days before the procedure. Patient is advised to have food before the procedure. Aseptic precaution have to be maintained. Material required for procedure should be kept ready. So the first one is Prachanna. We'll describe the Purva Karma of Prachanna. So sterile material is required like scalpel number 11, antiseptic solution, cotton pad, gauze, bandage, etc. So procedure of Prachanna, the part where the Prachanna has to be done is cleaned using antiseptic solution like betadine or Savlon or any spray. Then multiple pricks are made in a specific manner till there is appearance of blood. Blood approximately 20 ml is allowed to ooze out from the site. Prachanna should be done in a ruju, in line, asakirna, not joining each other, shukshma, fine or pointed, sama means evenly, anavagda, not very deep, anuttana, not too superficial, ashu, very quickly we should perform, and we should avoid marma, shira, snayu, anupagati without harming the marma, shira, snayu. So what is the Pashat Karma of Prachanna? The part is cleaned using cotton pad and pressure bandage should be applied. So this is the one picture we are using this needle for the Prachanna. Then indication of Prachanna. Prachannam pindita va syadvagade jalokasha twak isthe alabu ghati shranga shirev vyapake ashraji vat didam va shranga jaloko alabu bhi karmat. वाता अश्रक ग्रंथि पीडिका सकोटा रक्त मंडलम कुष्ठा अन्यभिहतम चांगम शोथा अंश प्रचयेत विषक. So Prachanna in the Indralupta, this is the indication like for Prachanna. So how does it is help in Indralupta? In Indralupta, doshas, kapha, rakta, pitta, vata are locked in the Roma Kupas and obstruct it. This limit the hair regrowth. Prachanna removes this vitiated dosha. Prachanna improve perifollicular vascularization. Prachayitva avgadam va gunja kalke muhur muhur liepe dup shantirtha. On our hospital only. So our senior performed this. So puncturing a vein for therapeutic purpose causes Shiraveda. So what is the Purva Karma? And material is required. Thaila for Abhyanga, Nadi Soida Yantra for Shoidana, surgical spray, cotton swab, gauze, bandage roll, tourniquet, scalpel, vein number 16, 18 or 20, kidney tray, glass beaker to collect and measure the amount of blood drained. So there's a few pictures you can see here. Then Purva Karma. Snehana Sthanika Abhyanga is done with suitable thaila to the part where Shiraveda is to be done. Shoidana, Nadi Shoida is given after the Abhyanga. A liquid diet of Yavagu has to be given. Patient is made to sit comfortably like a Janu Sama Asana. Eyes of the patient can be bound. Pradhana Karma of the Shiraveda. Tourniquet is tied above the site of the Shiraveda. As suitable vein is selected, the patient is informed and then the vein is punctured. As blood start coming out, it is collected in measuring jar or glass beaker. Blood is allowed flow out till it stops on its own unless the patient feels discomfort. So first we have to go for Sthanika Abhyanga, you can see in the picture. Then we have to select the prominent vein. Then we have to go for the Shiraveda. Then Pashat Karma. After this, the needle is removed and bandage is applied over this. So you can see in the left side picture, after the inserting the needle, blood is coming out, the Dushta Rakta. Then after right side the picture, after the collection of the blood, you should apply the pressure bandage. And then Vedana Pramana, Mamsala Pradesha, Yava Pramana, all other areas half Yava Pramana with the Vrihi Mukha Shastra. Shiras present on the bones, half Yava size with Kutharika Shastra. We should perform by these instruments. So amount of blood to be removed. One Prashta, almost 648 ml in Uttama Matra, maximum limit for and Bahudasha. This is the written in classical, but almost we are removing 100 to 120 ml in average patients. So now contraindication of Shiraveda. Bala is the Ruksha Chata Shira Viru Parishrant Madhya Padva Istri Karshit Vamit Virikta Asthapita Anuvasit Jagrit Kleeb Crush Garbina Nam Kash Shwas Shosha Pravadda Jwara Achepaka Pashaghat Upavasa Pipasha Murcha Prapidana Nam Cha Shiramna Vidya Yasha Vidya Vyadhis cha drashta ischa yantrita cha anuttita iti. So atha vishrita sarvang shopa chidasya cha amla bhojana nimitta pandu rogasya arsho darisho garbidinam cha swayatva. Individual with the sarvang shopa china because of. Yeah, tell me.
Doctor, you are exited the time limit. Please speed up.
Oh, sure. So, individual with the Sarvanga Shopa China because of Amla Rasa Pradhana Bhojana. Shopa in person with the Pantu Arshas, Udara Shosha and pregnancy. So, indication of Shiraveda, Vidradi Kushta painful Vataja Ek Deshaja Shopa, Palya Maya Shlipada, Vishajushta Shonita, Arbuda, Visharpa, Granthi, Istana Roga, Chudra Roga, etc. In Parmeya Pidika, we can go for this Shiraveda. In Medhaja Galaganda, also we can go for Shiraveda. In Vataja Vidruti, also it's indicated. In Shiraveda, in Chiragdip, most of the time we are performing for Siraja Granthi or varicose vein in our college. So, probable action of Shiraveda in Chiragdip, in case of varicose vein, due to venous hypertension, there is stretching of the veins which cause pain after Shiraveda. By the removal of the blood, there is decrease in pressure in the vein, thus reducing pain. Status of the blood is removed by Shiraveda. Shiraveda helps in increasing pumping action of vein by creating negative pressure. So, diffusion of RBCs into the tissue, its lysis and release of hemosiderin causes pigmentation is all avoided as RBCs are removed by Rakta Mokshana. The free iron is utilizing by the fresh blood flowing in, thus pigmentation doesn't occur. The breakdown of RBC also stimulates histamine at the site, causing vasodilation, vascular permeability and itching, which may be further lead to eczema, but all this prevent by the removal of the blood. Exchange of nutrients is possible. So, Samyak Vidya Lakshana, this sloka. So, Ayogyas are who are suffering from the Mada Mursha, Shrama, who does Vata with Mutra Vega Dharana, who is sleepy, drowsy, who are afraid, and not suitable, Kala, improper Vedana, cold and Vata predominant without Vedana, and after just having food, we should avoid the Shiraveda. So, management of Ayoga. If blood doesn't flow out, then a powder of either 3, 4 or as any of salt should be rubbed on the powder of 3 katu, Goduma, Hidra, and all that we can use there. So, Ayoga Karnas, Ati Ushna Ka, Ati Swadana, deeper cut, done by a person who isn't well versed or who isn't knowledgeable or excess letting of Rakta, reason of Ati Yoga. Ati Yoga Vyapat, Adimanta, Timira, Dhatu Shaya, Akshepa, Hikka, Swasa, Kasha, Pandu, Marana. So Ati Yoga Chikitsa, covering with cold moist cloth, application of cold qualities, and pouring cold liquids. If bleeding doesn't stop by the method, then Shara application or Agni Karma has to be stopped. Rakta, Stambhana, Upaya, Sandhana, Iskandar, go for this. So combination of or precaution and management. When choose another place for puncturing infection, maintain aseptic, hot compression, crepe IV fluids or vasoconstrictor injection or medicines. Now we can talk about Jaloka of Charna, using for the therapeutic purpose. So Purv Karma kept in the vessel containing turmeric powder for 1 Mohana. Jaloka is activated by this. Pradhan Karma, the patient is made to sit or lie comfortably. The affected area is cleaned. The
Vivek,
the selected Jaloka is made. Yeah, tell.
I'm repeating the same. You are
Yeah,
exceeded
madam,
the
tell
time
me.
limit. Speed up.
Okay. The selected Jaloka is made to bite the part. If it doesn't bite, then a drop of milk blood is put at the mouth and a stop is made over the affected area. So Pashat Karma, after the least detached, we can use Haridra and Sandha Lavada. Then we have to just do the tight bandage, then stop the bleeding. So after the assessing yoga, ayoga, according to Rakta, Benga and all that we can use, or Madhu can apply, or Sita Jala can be used. So complication is like we can go for Maha Agda treatment, like Lepa, Nasya and all that. In indication is in Pittaja Vidradi, in Raktaja Vidradi, in Pittaja Granthi, in Visarpa, in Vataja Galaganda. Rakta Mokshana we are doing in Arshas also in our college. You can see here. This performed in our OPD only. Then Jalokavchana in Dushtavarna also we are using. Then you can see we have done in college only. So problem mode of action, remove the vitiated blood and saliva of the least contains substance like hirudin, causing the anticoagulant vasodilation and local anesthetic effect also will be there. So clotting of blood, capillary circulation in the part. The Moksha Brana Shrota we can perform. So their mode of action, we will skip this part. Then Shringa. If you gunas are there, Ushna Madhura Snigdha, indication of Vata Pitta Doshita Rakta and Uttama Sthita Dosha. So procedure is conical hollow bend in Linn. This is like a length and circumference and all that. You can skip this. So preparation of Shringa is slender and is cleaned well, both inside and outside. Yeah, ma'am.
Is it over?
Yeah, ma'am. Hello.
Is it over, doctor?
Hello. Still, many slides are there.
Doctor, please speed up your presentation, doctor. Okay, doctor, please speed up your presentation, doctor.
Yeah, only 1 minute. Yeah, almost done. So Shringa application, there are a few Pradhan Karma would take to the mode of inside the horn during a suction. Help to draw the blood out. The Ushna Madhura Snigdha gunas of Shringa makes it useful in the so indication of Shringa in Vata. So now we can talk about Alabu. So indication Kapha Dosha Rakta Tvak Sthita Dosha. So procedure Alabu selects quite ignore too small skin So this, so Pradhana Karma, the site is clean and all that. So this is procedures. So mode of action: burning candle utilizes the air and create partial vacuum, which help to draw the blood out on its own, unlike in Shringa, where sucking has to be done. Kato guna of the alabo helps in the case of Kapha Rakta. Indication in Kapha Vidradi, in Kaphaja Arbuda. So discussion: Rakta Moksha is effective process. Example, Dushtavarna, it helps in quicker healing by improving blood circulation. Pigmentation by removing status of vitiated blood. In earlier stage of etc., it helps inflammation. We can use for localized condition. Jaloka, Shringa, Labo, we can go for this. Rakta is entirely as important as the dosha. Rakta Moksha is the type of concerned with the removal of Dushita Rakta. Prachina Steva are the types of Shastra Rakta Moksha, whereas Jaloka Churna, Shringa, Labo are the types of Shastra Rakta Moksha. So, okay. Thank you, madam. Hello.
Thank you, Dr. Vivek.
Thank you.
Next, I invite Dr. Shivakumar S. Shettar for the paper presentation on the topic Effect of Jalauka Acharna in Varicose Vein, a case study. Dr. Shivakumar, are you there?
Yes, sir, I am there.
Okay, doctor. Please share the screen, doctor.
One minute, sir.
Okay, doctor.
It's not showing, sir. Shall I start the video camera and shall I show in my laptop, sir?
Doctor, I will share for you, doctor. Please start the session, doctor.
Okay, sir. Good evening, sir. Thank you for giving the opportunity to share my slide. My topic is effect of Jalauka in varicose vein. That is Sira Granthi. Myself, Shivkumar Shettar from Ashwini Ayurvedic Medical College, Davangere, sir. And my contents are abstract, a condition in which a vein become dilated and elongated and tortuous. This means said as varicose. There is primarily well as secondary cause of varicose veins are the superficial perforating as well as deep veins are involved in varicose veins. The contemporary treatment of varicose veins includes ligation with stripping, and the surgical treatments will be there. But these treatments can be recurrence of the disease. So we choose the treatment in Ayurvedic tests like Jalauka Charana, which cures the varicose veins. And when we come to introduction, varicose veins refers to the dilatation of the veins in the legs becomes varicose. That is, they appear swollen and bulging and can be made out of outside, sir. Majority of varicose veins are seen mostly on the thighs and back of the calf muscles. There is lesser extensively on the inner side of the legs. The person involved in the prolonged standing, that means jobs like policeman, conductor, and teachers, etc., often suffers from the varicose vein. The common symptoms includes the heaviness of the legs and muscles, cramps, itching around the swollen veins, and pain felt in the whole leg, sir, and in the lower part of the leg, most common views. And the causative factors: weak persons and who walks longer time, and who dips his leg in the water, and a person who does heavy work, sir. And some clinical features of Sira Granthi are Sira Sankocha, that is a tortuous veins, and Sira Vakrata, that means irregular surface of the vein. and Sira Utsheda, inflammation of the vein, and Vishoshana, roughness and hardness of the veins. One case was there in our hospital, that is 45 years woman visited in our OPD, sir, with the complaints of pain over lower limbs from the cuff to the dorsal of foot of both legs, and had prominent dilated tortuous veins, sir. And she also had complaints of irregular bowel, but she had a dull aching pain associated with a throbbing sensation in the foreleg and ankle region of the left leg, as well as the burning sensation in the bones, both the soles since 1 year, sir. The pain aggravated on the long standing, especially in the evening and night hours, accompanied with a slight swelling at the left ankle region since 1 year. When we examined that patient, there was a pain and a tenderness, dilated tortuous vein present in the foreleg as well as the calf region. So some slight bluish discoloration was we found, sir, and no ulceration was noticed. Pain got relieved by the elevation of the legs, as she is told. The patient have given Pitta Aushadhi for 1 week internally, and we start the Jalokacharana procedure after 1 week, sir. We had also given the treatment of Sahacharadi Kashaya 15 ml, which is having the property of Vatahara property. And with that Sahacharadi Chala, we added the Arborium Plus, which is the allopathic syrup, which is having the antioxidant and minerals and some vitamins property, which is having the which help to protect the cells from the damage which is got from the free radicals, sir. And next, Rakta Moshana, after 1 week, we had started for 2 settings at a 7-day of interval of time, sir. And third, Vatajadi Tailam we have used, which is the banana root oil, sir, for local application. And Amritadi Gugudu 2 BID, which is having the property of anti-inflammatory and which is also helpful in the to decrease the swelling, sir. And the fifth one, we have added Kanchanara Gugulo 2 BID, which is having the property of anti-kapha property and Meda Dhatu, which decreases the Meda Dhatu, sir. And it balances the kapha and also decreases the Meda, sir. After that, when the patient came back for the purpose of which is showing the that veins which have subsided the swelling and the reddish discoloration, we observe that pain has been reduced almost 50 to 60%, sir, and swelling, itching, and discoloration also has decreased. But some varicose veins not affect on the tortuous dilated veins, sir, but maybe due to the inability of Rakta Moshana is correcting structural damage. And some reference I have added, sir. Some conclusion: varicose veins are dilated veins due to the improper function of valves. This leads to the stasis and thickening of the blood and finally ulceration. As stasis is the mainly reason, Shodhana of the Rakta is the best treatment. So Gritita the Jalajanmanabi, that is the Jaloka is the best method to eliminate the deep-seated thick blood. So Jaloka Charana is the right choice of the Siragranthi, Janyavarana, and leech therapy proves to be effective, time-saving, affordable, and acceptable treatment in the varicose ulcer, sir. So we can roughly conclude that Ayurveda can give the very good hope in the treatment of the varicose veins and the ulcer, sir. And these are some references regarding that treatment and introduction of the varicose vein and Jalokacharana. Thank you.
Thank you, doctor. It was
Yes,
well explained within a short span of time.
Oh, thank you.
So, dear participants, I would like to remind you the time limitation again. You should present a presentation within a time period of maximum 8 minutes. Kindly do follow the time limit.
Next, I invite Dr. Parshanath Jain for the paper presentation. Dr. Parshanath, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Wait. Okay, sir. Sir, can you please share my PPT, sir?
Okay, doctor, just a moment. I will share for you, doctor.
Thank you.
Please start the session, doctor.
Myself, Dr. Patna Jain, second year MS. I'm studying in Ashwini Ayurveda Medical College, Davangere. My topic is Jalukavacharana and its latest development in the surgical era. Next. In this, I'm dealing with introduction, historical aspect of each, and definition of Jaluka, habitat, and collection of leeches, types of Jaluka, practical applications of Jaluka, anatomy and physiology of leeches, latest advancement in the field of leeches, bibliography, and then conclusion. The importance of Jalukavacharana. Next slide, sir. Historical aspect of the Jalukavacharana. In Sushruta Samhita, the oldest available manual on the surgery has developed the entire chapter for the description of Jaluka in the chapter Jalukavacharaniya Adhyaya for the purpose of bloodletting. Jalukavacharana is claimed to be supreme therapy because the safety and high efficacy in the disorders involving in the vitiated blood. A briefly description of Jalukavacharana is provided in the forthcoming slides on the ancient consideration followed by a modern review. There was an used a surgical agent to extract the blood of a patient in the painless manner. For this reason, the leeches were extensively used in the past surgery for bloodletting. From the time of early Greek medicine, there is a record of leeches for bloodletting. So next slide. Purido medicinalis was most commonly used in the Plimidopoeny in Europe. In modern times, in olden times, the practice at the one time spoken as leechery was a common that the doctor themselves was often called as leeches. The medicinal leech of America is Macrodabilla desosa. Great was the demand for the leeches medicinal use for suitable species were evaluated and cultured. And Nectrib 1912, the reference of Unani medicine. The Unani medicine has also described the surgery. In this, there are mentioned leeching has a leak according to them. Leech application is unique method of removal of toxic matter from the blood. It's usual for slime disease, that is the baldness and ringworm. Certain conditions have been laid down by the physician for applying leeches, that is the kind of leeches to be applied water from where there are to be obtained, etc. Next slide. Reference to made by Hippocrates. The bloodletting tools have been dated to the Stone Age. There is an evidence of therapeutic bloodletting among the ancient Egyptians and Babylonians. All through the first written record of the practice is found in the Corpus Hippocraticum. The Hippocrates believed that disease was caused by imbalance of four humbers: the blood plegum, black bile, and yellow bile. That bloodletting played an central part in restoring balance. There are classification. Rakta Mokshana has two types, that is Ashastrakrit and Shastrakrit, Shrunga, Jaluka, and Alabu, and this Shastrakrit, Prachana, and Siravyada. Jalukavacharana definition. Jalokastu Sukhinam Rakta Stravayaha Yojayat. There are two words, that is Jala and Vayu, the animal having water as life. The Jala plus Voka, that is Shabdalpak Druma has considered Jaluka as a feminine gender and defined that it as an aquatic creature employed to expel out the vitiated blood. Bhavadra defines that Jaluka has an animal living either in water or in mud with a distant abdomen. The synonyms of Jaluka, that is Jaluka, Jaluka, and Raktapa and Rukata. The classification, there are two types, there is Savisha and Nirvisha Jaluka. There are Savisha Jaluka. The Savisha Jaluka originates in ponds of stagnant, turbid water containing a decomposed body. And then some of general characteristics of Savisha are, that is Madhya Parikshit, and there are types of Savisha Jaluka, that is Krishna, Karbura, Alagarda, and Indrayada, Samudrika, and Gochandana. This Krishna resembles the black color. And next slide. Karbura is resembled like this, and Alagarda like this. Indrayuda, Samudrika, and Gochandana. The features of Savisha Jaluka bite, that is Swayatu, Atimatram, Kandam, Murcham, Jwara, Daha, Chardi, Mada, Sadhanam. Next slide. Nirvisha Jaluka. The Nirvisha Jaluka has originated in decomposed vegetable matters as putrefied stem of the several aquatic plants known as Padma, Utpala, Nalina, and Kumuda, Pundarika, and most common zoophytes, which the characteristics of Nirvisha Jaluka are Mahashira, Balavatyam, Shigra, Paino, Mahashan. The Atas, Nirvisha, Kapila, Pingala, and Shankamukhi, Mushika, and Pundarika Mukha, and Kapila. It resembles like a green Pashwambu, and this one. Next slide. Pingala is Rakta, Rutta Lakshana, Shankamukhi, Mushika, Pundarika Mukha, Savarika. This is a red slide, sir. That is the main giant Amazon leech, and this is the largest species of leech found throughout the northern South America. The giant Amazon leech is the largest species of leech in the world, with the individual growing up 4 inches wide and 18 inches in length. Unlike that is habitat and collection of the leeches. The habitat of leech is method of collection and time of collection, preservation of the habitat of non-poisonous leech, that is Yavana, Pandya, and Sahya, and Pautana in Deshaga. The method of collection, that is according to Chuchula, has told that the leeches has been caught with a piece of wet leather in tanks, streams, and water bodies where there is a lotus. There is another method to collect of leeches in is the fresh meat of dead animals, fish, or milk must be applied through thigh of an animal. The human himself and tie around the thigh and immerse the tight part janga in the water for some time. Due to an attraction towards these diet, and Jaluka will come to and start biting. Then there may be a leave dead meat and skin with the application of Saindava Lavana and collected. Time of collection, it is Sharat Ritu. The October to November is the best time of collection of leeches. The preservation of leeches, it should be put into a large sized new pitcher filled with the water slime of the pool. The pulverized zoophytes and powder of dried meat and aquatic birds should be put into a pitcher for feeding. Blades of grass and leaves of aquatic plants should be put into it for them. Like this is a way of keeping preservation of leeches. The indication Rupa, Anga, Bala, Stavira, and Viru, Durbala, Nari, and Sukumaram, Anugrahatvam, Para, blood vitiated, the Vata, Pitta, and the Kapha should be let out by means of Stunga and Jaluka Alabu respectively. Leeches are emerges from water, lives in cold climate, and is sweet and such a useful bloodletting in those diseases vitiated by Vata. The indications of Jaluka Vacharana is Gulma and Ashas, Vata Rakta and Kushta and Dustarana, Shvayato and Sklina Gulfa, Charma Roga and Charma Roga. These are in our hospital. We are classical methods of application of leech, that is Purva and Pradhana and Paschat Karma. The Purva Pradhana, the patient has to examine the patient who are fit for Jaluka Vacharana, and preparation of the patient. Snehana and Shvedana Karma was instituted to the affected site where such a leeches is to be applied. The affected part is to be rubbed by a rough powder and Gomaya Chuna, and it is contraindicated in the part of is ulcerated. Jaluka selection of leech and activation of before application of leech, it should be kept in a haridra and mixed with the water till they become active, and then cleaned with the help of pure water. Activation of leech, according to Acharya Vagbhata, the suitable jaluka has been selected and kept in a water containing in a nisha, kalka, roma, soma or takra, and it should be made of comfortable by putting back into pure water. Scientific reason behind in the activation of leech, that the digestive tract of the medicinal leech has been found out the contain of two types of bacteria, namely Aeromonas veronoi and Aeromonas bicanella. If these enter into a blood circulation, it may causes wound infection. Next, let's Pradhana Karma, the patient must be prepared as stated above. The leech is to be much unpurous and soft, and as resulted, it slips off from its hand. It should be better to catch the leech either with the gauze or after wearing a rubber gloves. Then the leeches should be taken out of the respectables and put over the selected slice. The leeches attached to the skin by a two muscular sucker before biting the three jaws. Instead, there is an anterior sucker and takes the shape of horseshoe shape. That is, the leeches having sucked the affected part by inferred by from the mouth, the leeches assuming the shape of horseshoe, that is raised and arched. The position of there is next of further hands attached to the seat of the disease. If the leeches does not bite the designated part after start leching, Chandra Stravaya Vachanam Krutya Darayet. Indicating a sign of removing leeches. Damsha Toda Kandu Prabhava Jalukastu Ravaneva Pragdustameva Raktam Pivantihi Yata. Direction of removal of leeches. That sometimes leeches are refused to fall even after application appearance of desired sign due to a fondness and for the smell of blood. They should be sprinkled the paschat karma. First, the care of patient, that has to be samyak yoga lakshana has to be attained. The shonitasya yoganam ramsham tatprasthitaha. As soon as leeches is removed, the care of leeches after falling of the leech body should be anointed with the rice puff. Mouth should be massaged with the oil and salt. Samyak Vanta Lakshana, the finding a proper vomiting, the leeches has vomited fully quantity of blood sucked with the move very actively and for quest of food when placed in the water. Contrary, there is no complete vomit of blood, there would be a lying dull. Druvanta Lakshanas, that is ya sidati na cheshtato sa dhuvanta tam punaha samyak vamayet. Anatomy and physiology of leeches that has been, this is basically there are around 650 species of leeches found all over the world. The medicinal leeches commonly used in the Hirudo medicinalis or European medicinal leech. Other species sometimes refers to Hirudina. That the genus Hirudina comprises freshwater leeches, which is herbivorous in habit and attack domestic animals and man. The four species there are found in India, that is namely that is H. Javinka, H. and Manalysis, and H. granulosa, and that's the feature of H. granulosa that the H. granulosa majorly measures the 12 inches in length, and it's elongated in nature. The dorsal surface of is more or less in transverse section. The dorsal surface is green and ventral orange. The external surface of the body is segmented into 100 ring annuli by series of well-marked gloves with these organisms have two suckers, one at each end, and called as anterior and posterior suckers. The posterior suckers is used as this is a sucking. The anatomical position of the enzymes and chemicals secreted by the enzymes and actions are. These are the enzymes that we are mentioned, that hirudin, kallin, and these are some enzymes which with their action. Mode of action. A medicinal leech is small factory to manufacture biologically active substances which has following actions: normalization and improvement of capillary circulation, vasodilator, correct the venous hypertension, anticoagulating agent. The mode of action. Yes, ma'am.
Please speed up.
Okay. Mode of action of TAO. In the case of TAO, where the mode of action of varicose vein and ulcer, the venous decongestion and reversal of edema, hyperpigmentation of reduces, the healing of varicose ulcer, the mode of action and inflammation, the mode of action of skin grafting and microvascular surgeries, the failure of adequate venous return from the graft reduces the blood supply, causing a tissue necrosis. This is a necrosis reduced by next slide. The complication, the research field breakouts of the Hiradin is a synchronized using a recombinant technique called as bilirubin. The device which called as mechanical leeches that dispense the Hiradin performs a mechanical leech device invented to augment the blood removal for passive bleeding. The uses of mechanical leeches that is used to relieve the various congestion and prevents the pooling of blood in increases and bilirubin semi-synthetic derivative of Hiradin. Uses of bilirubin, that is advantages of over-apparent. That's the bilirubin inhibits the blood clot bound the thrombin as well as circulating the thrombin and fractionated the heparin branch into a plasma. These are the heart failure, and these are some slides. The discussion that indicates that the leads told by a Shrushruta holds a good till today as it can safely applied in all the ages and various blood disorders. So many people fears and faint just by the sight of blood. Hence, it is visualized appealing as the blood letting out by leech won't be visible to the patient by making them comfortable. It is very cost. The conclusion, the clinician who knows all about the leech's habitat, their method of collection and various storage and application and successfully in treating a disease of amenable to them. Thank you, sir.
Thank you, doctor.
Thank you, doctor.
Thank you.
Dear participants, we admit that there is a delay in the schedule. So please cooperate with us and try to finish your presentation within your time limit. Thank you.
Next, I invite Dr. Surya Raj for the paper presentation. Dr. Surya, are you there? Hello, Dr. Surya, are you there?
Yes, sir. Yes, I'm here.
Okay, doctor. Please share the screen, doctor.
Yeah, sure. Screen is visible, sir.
Yes, doctor. Visible, doctor. Please start the session.
A very good evening to one and all. So before going to the topic proper, I would like to talk about two sides of the same coin. So one side, there is a violated tradition about how women are expected to stay same throughout the month. That is the liberal minds, which we see in advertisements wherein they expect females to run, jump, walk, and whatnot, even during menstruation. But what about the physical health? Similarly, there is a revolting attitude when we look into the tradition of having a guilty feeling of being impure or a self feeling of disgust. So, what about the mental health? With this background, let me introduce you to the topic complementing menstrual health through Ayurveda. Myself, Dr. Surya Raj. So, before going to how Ayurveda helps in complementing the menstrual health, I would like to talk about how we can break the menstrual taboo. So what is menstruation? Menstruation is the visible manifestation of cyclic physiological bleeding due to shedding of the endometrium following visible interplay of hormones, mainly through hypothalamo-pituitary ovarian axis. And what is taboo or menstrual taboo? So taboo basically means something that one must not say or do. So why menstruation has become a subject of taboo, shame, silence, fear, or keeping it unnamed? We even don't want to say the word out loud, feeling ashamed. But was menstruation always considered a negative experience? When we look into Ayurveda, Ayurveda talks so much about the upliftment of women. Sometimes negative things are heard that Ayurveda says women is isolated during menstruation because it is considered to be impure. But these are just misunderstandings stemming from general rise of Western thinking and have little to do with Ayurveda. So what does Ayurveda say about menstruation? It calls menstruation as Arthavasrava or even Ritusrava. The term Ritu is used to denote menstruation. So when we look into the other meaning of Ritu, Ritu directly means seasonal. Arthava also means season. So that itself says, the term used, Arthava or Ritu itself says that it is like different seasons. So there is an obvious change in energy of earth, as in the Shad Ritus we see. The same is with a woman. So even women has different changes happening in her body due to the menstruation. So why this isolation is told? So there is isolating women during menstruation. So what is the necessity of it? It is basically for the energy or attention that she needs during this time. So to hype up the energy, it is definitely needed. And as we know, Ayurveda considers Arthava as Upadhatu of Rasadhatu. And this itself, when we say the term Dhatu, Dharana Datavaha. So even Upadhatu has a function of Dharana. That means it is a secondary tissue that is nourishing the body. So definitely Arthava has its own prior importance. So coming to the definition as such, Ritusrava Rasadeva Striyaha Raktam Rajah Sanyam Pravartate Tadvarshat Dvadashat Urdvam Yati Panchashatah Kshayam, where in Sushruta Samhita it is basically talking about what Arthava is. So it is nothing but coming out of Rasadhatu as such, which is also termed as Raja, and the age has been mentioned. So after 12 years. Now what is the function of Arthava? Again in Sushruta Samhita we have reference of function of Arthava. Rakta Lakshanam Arthava Garbhakritya, one which has the capacity to do Garbha. Dhana is nothing but Arthava. Now coming to the modern point of view, wherein menstrual blood has potential. So today's researchers says that menstrual stem cells have similar regenerative capacities as that of umbilical cord blood and bone marrow. And it has the ability of differentiating into other types of stem cells like cardiac, neural, bone, fat, and cartilage. So this definitely is a turning point, as in we consider it as Upadhatu. Arthava Upadhatu is substantiated with this research. So how can we enhance the menstrual health? So what are the reasons? So before looking into enhancing, let's see why there is a depletion in menstrual health, or what is the necessity of talking about this topic. So not following menstrual regimes, altered lifestyle, unhealthy food. Because in today's most of the researchers, we find that females who have consumed spicy or non-veg food, or who even indulge in excessive physical exertion, are definitely suffering from Arthava Vikara. So basically it is the lifestyle that has led to various conditions. So what has Ayurveda got to do with enhancement of menstrual health? So Ayurveda says no to any strenuous activity, no bath, snana varjana for 3 days, divaswapna varjana, exposure to vata, atapa and excessive vyayama is a big no, and vyavaya and also shoka. So all this are not to be done. The main reason being it leads to vata vriddhi. As we know, apana vata is the one which regulates the functioning of Arthava too. So apana vata is concerned with expulsion of semen, menstrual blood, feces, urine and fetus. So apana vata plays a main role in balancing the Arthava, and yes, everything related with Arthava. And as we have references of Swadhisthana Chakra also playing a main role in regulating the functions of the organs related with pelvis. And similarly, yoga has certain things to help on with the menstrual health. So there are various asanas and pranayama. How pranayama is going to help in menstruation? So it helps by acting on the HPO axis. So which kind of asanas are helpful? So Pavana Muktasana, which strengthens the pelvic muscle and stimulates hormonal system. Pada Uttanasana strengthens pelvic muscle. Naukasana eliminates nervous tension and stimulates hormonal system. Marjalasana gently strokes reproductive system, relieves menstrual cramp and leukorrhea. Shashankasana tones pelvic muscles and strengthens black muscles. Bhujangasana tones uterus and ovaries. Shalabhasana strengthens pelvic organ. Dhanurasana stimulates ovaries and is useful in managing menstrual disorders. And Baddhakonasana, which helps in toning pelvic muscles. So these are the postures, the asanas, which I was just talking about. So with this, let me just conclude with the whole session of how important it is to take care of the health of females, and during menstruation, why it is important to have sufficient rest. So let's embrace the right tradition and stay away from the misleading women liberation. Thank you. Thank you for providing me an opportunity. Thank you, Anna.
Thank you, Doctor.
Thank you, Doctor.
Wonderful presentation.
Thank you, ma'am. Thank you very much.
Next, I invite Dr. Sheetal Raj for the paper and poster presentation. Dr. Sheetal, are you there?
Yes, sir, I'm here.
Okay, Doctor. I will share for you, Doctor.
Yes,
Please
thank
chat.
you, sir. Namaste all. Myself, Dr. Sheetal from Yanapoi Ayurveda Medical College and Hospital, presenting before you a novel approach to aging and its treatment in Ayurveda. Am I audible? Though it is inevitable
Yes, Doctor,
to
you're
grow
audible.
old, though it is inevitable to grow old, age-related diseases are a threat to people all over the world. With aging, the response to various stressors takes longer time to revert back to normal structure and function. Please move on this slide. A longevity of an individual depends upon intrinsic genetic factors, environmental factors, a lifestyle of an individual, and age-related disease. Here, the intrinsic genetic factors, the previous slide. The intrinsic genetic factors includes extrinsic and intrinsic factors, which leads to apoptosis. Environmental factors includes the inhalation of dust, consumption of different diet, and the role of antioxidants. A lifestyle of an individual includes the use of alcohol, tobacco, etc. And age-related disease include a wide variety of disease that like diabetes mellitus, Parkinsonism, etc. Please move on to the next slide. Moving on to the cellular basis of aging, a person ages when the cell stops functioning and gradually stops functioning, and this is reflected by the structural and functional changes within the organ and system in a human being. And these are supported by certain theories like, please move on to the next. These are supported by certain theories like DNA damage in aging, free radical theory in aging, mitochondrial damage in aging, and also activation of tumor suppressor genes. Move on to the next. So these are some of the organ related, like these are some of the diseases which are related to aging. And moving on to what is meant by xenobiotics. So xenobiotics are certain chemicals which are, please move the slide. Next. Xenobiotics are chemicals which are extrinsic to the normal structure and function of a human being, and environmental pollutants, tobacco, alcohol. Next slide, please. Environmental pollutants, tobacco, alcohol, and ionizing radiations are considered as xenobiotics. Here, environmental pollutants are acted upon by the sunlight to produce secondary metabolites of like free radicals and antioxidants, which can lead to oxidant cell injury to the respiratory passage. Tobacco can lead to the production of free radicals, and this can lead to apoptosis, cell injury, and cytotoxicity. And alcohol, most of the injury which are produced by alcohol are due to the direct effect of alcohol, and also by the production of a secondary metabolite called acetaldehyde in blood. And ionizing radiation can lead to the production of free radical, which can lead to DNA damage and apoptosis. Next slide, please. And Garavisha, as you all know, Garavisha is a unique concept in Visha Chikitsa as a combination of known toxic substances. And these Garavisha has a lot of similarity with that of xenobiotics. And here, xenobiotics are the chemicals which are extrinsic to the normal metabolism of human body, whereas Garavisha is considered as a artificial poison. Next slide, please. And the xenobiotics reach a toxic concentration without proper metabolism, whereas Garavisha is Kalandara Pragopi. So Kalandara Pragopi is that which remains in the body for a longer period of time without undergoing metabolism. And here, environmental pollutants, food additives, tobacco, etc. are considered as xenobiotics, where all the Virataharas and all the Stavravishas can be considered as Garavisha. And xenobiotics can lead to a wide variety of age-related diseases, and almost all the important organs are affected by Garavisha. Please move on to the next slide. So Garavisha Chikitsa includes Patyahara, Vamana, and Hridayavarana. Here, Patyahara can be considered as a prevention of further exposure of poison, and Vamana is a purificatory therapy, and Hridayavarana is a protection of Hridaya, or like any other organs which is affected by the poison. Next slide, please. And move on to what is the Garavisha Chikitsa in aging. So Visha has all the properties which are opposite to that of Ojas, and the seat of para-Ojas is Hridaya. So when a person is affected by Visha, both Ojas and Hridaya are affected. And when an antitoxic preparation is given to the patient, it can act as Ojo Varthaga and Hridvishodhana. So here, Ojas can act as an antioxidant, and also it can act as an immune booster. So when Visha Chikitsa is given in aging, it has many aspects. Like it can act as a it will act as a preventive aspect. Like it has a preventive aspect, it has a purificatory aspect, it can act as an antioxidant, immune booster, and also it can act as an antitoxin. Please move on to the next. To the last drop, all the agadas or antitoxic preparations are by default rasayana. So all the agadas which are used in the treatment of Garavisha are needed to be analyzed properly to know whether it is useful in aging or not. So further research on this will definitely open up a new door to the invention of a novel treatment protocol in aging by Visha Chikitsa. This is all I have to share with you. Thank you for your patient listening.
Thank you, doctor. Next is a poster presentation.
Yes. Can you share the poster?
Please start the session, doctor.
Myself, Dr. Sheetal from Upayas Medical College and Hospital, presenting before you an overview of adverse drug reaction as a cause of toxicity with special reference to Aushadha Vyapat. Safety of a drug is a matter of concern since time immemorial, and the statement that herbal medicines are free from side effect is a myth. The various procedures like Ashodhana Marana Samskara of herbal and metal drug signifies the importance of drug safety in Ayurveda. It is imperative to critically assess the nidana of a disease, indication and contraindication, patya, bhatya, and anupana before administering any drugs to check an adverse drug reaction. Adverse drug reaction is a broad term referred to unwanted, uncomfortable, or dangerous effect of a drug. And here the types includes dose-related ADR, which is by narrow therapeutic index, allergic ADR, which requires a prior response, and idiosyncratic ADR, which is a genetically determined abnormal response to a drug. And here the cause includes unqualified practitioner, substandard product, which includes inappropriate testing, incorrect identification of drug, improper storage and the use of adulterants, and improper intake, which includes a prolonged consumption of a drug or absence of a dose fixation. And the fourth point is toxicity. So this toxicity includes nephrotoxicity, hepatotoxicity, cardiotoxicity, etc., based on the consumption of the particular drug. And here the diagnosis is by a timing and pattern of disease, and sometimes symptoms are seen soon after the consumption of drug. And in chronic cases, use of a drug, it will be delayed. The symptoms will be delayed. So here treatment given is modification of a dose, withdrawal of a drug, and switching to a different drug and specific treatment. Moving on to the Ayurvedic part of this, that is Aushadha Vyapak. This is considered as the unintended action of a drug. And the causes for these are Akale Alpa Adimatram Ja, Puranam Naja Bhavidam, Asamyik Samskridam Cheva, Vyabede Daushadam Hida. And this is a reference from Charaga Siddhisthana, 6th chapter. Akala can be considered as the improper time of administration, improper time of collection. Example for this is green leaves collected during rainy season is believed to have more amount of toxin in that. And Alpa Matra, that is drugs like bhang or ahifena or its preparation when used for a longer period of time can lead to drug dependency or like accumulative toxicity. In Adhimatra, there is a proportion for every ingredient in a yoga. There is a formulation, especially when a toxic drug is used, and Adhimatra can lead to acute or chronic toxicity. And Purana is old. Time plays an important role in drug reaction. When a drug or formulation is stored beyond its shelf life period, it can lead to the production of a bacterial toxin and can lead to either it can lead to death of the person or it can lead to different diseases. And Abhavidam is absence of purification. And here purification of ahifena is by giving bhavana for 21 times. And if here the bhavana is not done properly, it can lead to toxicity. And Asamik Samskrida is improper purification. And this includes Shauja, Manda, Desha, Vasana, etc. Shauja is related to hygiene. Manda is like Bhavana. And Desha is the place from where it is collected. And Vasana is the utensil which is used for storing the drug. And moving to the conclusion, toxicity is a cause and effect of adverse drug reaction, manifestation, and Gara, Doshi, and Sukshma Visha can occur due to adverse drug reaction. And quantity and quality of bioactive substances varies according to the part used, environmental condition, method of collection, preparation, and storage. And evidence-based research should be encouraged to document the data regarding positive and negative effect of a drug. And the entire adverse drug reaction can be summarized with a 2-line sloga from Charaka Samhita. Yoga tapi visham tishnam, uttamam bheshajam bhavet, bheshajam chavituriyuktam tishnam sambhatyate visham. With this, I conclude. Thank you.
Thank you, Doctor.
Both are
Thank
well
you,
explained. Thank you.
Thank you, sir. Thank you, ma'am.
Next, I invite Dr. Shraddha Sunil for the paper presentation. Dr. Shraddha, are you there? Dr. Shraddha Sunil, are you there?
Hello.
Hello, Doctor. Please share the screen, Doctor. Hello, Dr. Shraddha. Hello, Dr. Shraddha, can you hear me?
Yes, I can hear you. Am I audible?
You are audible, Doctor. Please share the screen, Doctor. Doctor, you have any problem with screen sharing, Doctor?
Yes.
Doctor, your screen is now visible, Doctor. Please start the session.
Myself, Dr. Shraddha Shivshankar, and my topic for today's presentation is an Ayurvedic management of organ matter, a case study. So the Shira is a plant occupy a prime position in the Urdhva Chaturga Trikara as it is the son of Prana and Indriya. Ardhavedha offers due to the vitation of the three dosha. The attack of Ardhavedha will occur once in a 3 days or 15 days and once in a month as per classic text. As per Acharya Charaka, it says that Ardhavedha is left untreated, it leads to the diseases like deafness and blindness. Swasthya karma is considered as the best therapeutic intervention in the Shirogas by Acharya Charaka. Ardhavedha mainly caused due to the predominance of Vatadosha or Tridosha. Pathetic what is mentioned in Shavasana Samhita, especially in management of Shiroga. Acharya Shivshankar has mentioned that Nasya is said to be the ultimate treatment of Ardhavedha when all treatment fails, as in Nasa is considered as Shiroga. Dr. also mentioned a same line of treatment for the Ardhavedha in which Nasya is included. Shadabindu Tel is Tridosha not and Shiroga according to the Pesha Jajatnami. The present paper summarizes the clinical efficacy of flow of Shadabindu Tel and Nasya and pathetic war as a shaman dravya in the management of Ardhavedha. Ardhavedha is one of among 11 types of Shiroga considered by our Acharya, in which pain is appreciated, but in one half of Shira, Shankha, Bru, Lalata, and Karna Pradesha. Ardhavedha is one of the Shiroga which can correlate with the migraine. Ardhavedha occurs due to the vitation of three doshas. The attacks of Ardhavedha will be once in a 3 days or 15 days and once in a month. As per Acharya Vakata, Ardhavedha according to Acharya Charaka, Vata either alone or in a combination with Kapha seizes the one half of head and causes the Ati Vedna in the side of Manya, Pru, Shankha, Karna, Akshi, and Lalata. If the condition becomes aggravated, it may even enforce the function of Netra and the Karna. Migraine is episodic headache disorder usually characterized by pain involving either half of head according to Headache Society, migraine constitutes 60% of primary headache and affects about 10 to 20% of general population. Is a recurrent headache disorder with the intense pain that may be unilateral or accompanied by nausea or vomiting as well as photosensitivity and phonosensitivity. Due to the similarity of the signs, migraine can be understood as a Ardhavedha. Ardhavedha mainly caused due to the prevalence of Vatadosha. According to Acharya Shivshankar has mentioned that Nasya is said to be ultimate treatment of Ardhavedha when all other treatment fails. Yoga also mentioned the same line of treatment for Ardhavedha in which Nasya is included. According to Kanchan Shivshankar, and Shiroga, so it is used for Nasya. So, aim and objective of this paper is the detailed study of Ardhavedha according to Ayurveda Sahiha and to understand the pathophysiology of migraine and to study the combined effect of pathetic and Shadabindu in management of Ardhavedha. Here is a case report. A 30-year-old male patient recipient of Ardhavedha visited Shalya in our Ayurveda hospital. He presented with the chief complaint of severe headache involving right side of the head since 1.5 years and interval of the 15 to 30 days. Headache is also associated with the nausea, mild giddiness, and no classic focus of neurological events. Aggravating factors for the headache were stress, bright sunlight, noise, intake of spices food. Patient was receiving allopathic treatment for the 1 year without any marked improvement. The patient was diagnosed with the migraine on the basis of clinical features and assessing dosha. So here is the examination. In his Ahara Chetu, his diet is predominantly of the Katu and Kashaya Rasa and Buksha Ahara. His body was Vata, Mudra was Prakrut, Jiva Avitya, and his Prakriti was Vatapada Papanubali. Other general examination and investigation were normal as per shown and for the treatment, we ask patient for a Nidan reversion to avoid the Katu and Ruksha Ahar. It was specially strictly advised to avoid fast food and spicy food. And for the medical, for the internal, we give given the patient 50 ml of Pathyatik twice a day for 7 days and Nasya with Shalya at morning for 7 days. So for the Nasya, we ask patient to lie down in supine position with head low and neck slightly raised. Sonic smear was done on the face, forehead, neck, and ear with the tail leg for 10 minutes, and mild sonic fluid feather done for 10 minutes. For a Kadam Kanchan, patient was made lie down in supine position with head low and neck extended. Then lukewarm Chiragdip was instilled slowly in either of nostrils. Same procedure repeated on the other nostrils. A dropper is used to instill the oil and 4 drops of oil instilled in each nostril. In Paschat Karma, patient was asked to remain in position for 5 to 10 minutes. Then Islamic Buddhist is given and covered with the lukewarm water to spit out the excess collateral secretions. The patient was advised to avoid dust, smoke, sunshine, alcohol, riding, anger, excess fatty, and liquid diet, day sleeping, cold water for any purposes like harness, etc. The improvement was assessed by the following criteria, that is severity of headache, duration of headache, frequency of headache, giddiness, nausea, vertigo, and photosensitivity. So before treatment, the severity of the headache is on 4 point, and after treatment it was 1. Duration of headache was on 3, and after treatment it was on 1. The frequency of headache, yeah, it was on 3, and after treatment was 1. The other symptoms were nil. So here is the discussion. Migraine is WHO has ranked migraine among the world's most disabling medical illness. The scope for the prevention of the disease in modern science is not satisfactory. So an attempt has been made to study the complete aspect of this disease and to find the best possible way for the betterment of mankind. According to Acharya Shivshankar, according to Charaka, it is a Vyadhis and Vata Pradhan, and Acharya Kalina stated that Ardha with Vata Pitta. In conclusion, we can say that it is a Vata dominant yoga. Shaman Chikitsa, that is internal medication. Pathyatik Vata is mentioned in Sharma Saita, especially in management of Shri Roga. The decoction has ingredients having Ushna Vedya and the Vata Shaman properties. Nasya, in Ayurveda, Nasya therapy is considered as one of the most promising treatment for all Urdhva. The effect of Nasya gives significant relief in diseases associated with nose and head regions such as migraine. The aqueous part of the active principle will be easily absorbed to the movement, that is nasal mucosa or olfactory mucosa, and for fat soluble active principle can be released assimilated through the nerve ending, that is trigeminal olfactory. The drug is administered through the nostrils reaches the Marma by the nasa and spread in the Mudha, taking roots of Netra, Shrotra, Kantha, and the Mukha Sira, gathering the morbid dosha in the Urdhva Jatru. Shadbindu Tai, the own karma of country of Shadbindu Tai, which is a Vatshamak, Dunga Rasa, Kappa Shamak, Erenda is a Vatshamak, Tagar is a Vatakappa Shamak, Shatavaha is a Vatakappa Shamak, Jivan is 3 Dosha. Rasna is a Kappa Shamak, Vidanga is a Vatakappa Shamak, Yashti 3 Dosha. These drugs used for massive karma help in stimulation of vasodilatation for nerves which are spread out on Urdhva Jatru. This increases the blood circulation to the brain. With all these contributing factors, it can thus be said that Nasya Karma brings effective relief to the patient suffering from migraine. This study signifies the role of Ayurvedic management of Ardha, that is migraine, the human body as a holistic approach to the positive dosha and treating the full system rather than just a part of it. The patient can have significant relief in the symptoms. Nasya Karma and Ayurvedic medication is simple, holistic, effective treatment modality in Ardha Veda without having any adverse effect to the patient or better assessment of the result. The treatment adopted here needs to be administered to the large number of population. Here is a reference for my study.
Thank you, Dr. Shraddha. Next, I invite Dr. Priyanka for the paper presentation. Dr. Priyanka Tiwari, are you there?
Yes, sir.
Okay, doctor, please share the screen, doctor.
Yes, sir. So, can you see the screen?
No, doctor, not visible.
Not yet.
If you have any problem with screen sharing, doctor,
Yes, sir. I'm having problem in screen sharing.
please share
Can
for you,
you?
doctor. Please start the session.
Yes, sir. Role of yoga and dietary habits to relieve the constipation with special reference to Malava Stambha. In the guidance of Dr. Gadwai. Next slide, please. Introduction. Constipation is most commonly seen complaint in this area due to lifestyle, food habits, and sedentary lifestyle, and certain bad habits like smoking and tobacco chewing. Along with this, excessive consumption of non-vegetarian food, oily and spicy food, lack of fibrous diet, drinking less amount of water, and mainly due to the loss of exercise and immobility. And constipation is mostly seen in the old age, that is geriatric and old age people. According to Ayurveda, the main cause of constipation is Vat Prakop. Role of yoga in constipation. Uh, Yoga may relieve your constipation by initiating gut mobility, by doing certain exercises. Different poses of yoga may stimulate digestive tract to pass the stool forward, and yoga exercise also improve the power of digestion. Next slide, please. Role of dietary habits in constipation. In general, high consumption of whole grain fruits, vegetables, nuts, and seeds promote the bowel movements. Conversely, high consumption of fat, fast food, junk food, or processed food has been associated with functional gastrointestinal disorder. Drinking plenty of water along with liquid diet, which buttermilk, will improve the digestive system. Consumption of fibrous rich diet will lead to soften the stool formation. Next, please. Aim and objective to highlight the key message that is common to many of the existing guidelines, critically reviewing, commenting of any differences to assess the effectiveness of yoga in management of constipation. Next, please. Material and matter. This review was done by compiling classical Ayurvedic literature, modern literature, magazines, research journal, as well as PubMed and Medline database. Clinical features include the inability to have a bowel movement for several days or passing hard stool or dry stool, abdominal pain, cramp in abdomen, bloating, decreased appetite, lethargy, and straining during defecation. Complications of constipation, which includes hemorrhoids, due to continuous straining to have a bowel movement, may cause swelling in the veins in and around the anus, acute fissure in ano or chronic fissure in ano due to passing of hard stool through the anal mucosa will cause tear in the anal region. Fecal impaction due to chronic constipation, hard stool will get impacted into the intestinal tract. And last one is a rectal prolapse. Straining to have a bowel movement can cause a small amount of rectum to stretch and protrude from the anus. Next. Yogasanas which are described for constipations are Mayurasan or peacock pose, Vajrasan, Halasan, Pranayam, Paschimottanasana, Pavanamuktasan, Bhujangasan, Ardhamatsendrasan, Shalabhasan, and Balasan. Mayurasan, which is known as a peacock pose, this asana resolves the digestion issues and increase the appetite, clear all the blockages. It also helps to pass the flatulence. This is the pose actually having Mayurasan.
Vajrasan, second one. Vajrasan is one of the easiest yoga asana for relieving the constipation, which curing the indigestion. It is also done after having a meal. Vajrasan helps to improve the blood circulation in the abdominal area. Most importantly, this pose can treat various conditions like chronic constipation, digestive issues, stomach disorder. In addition, this asana can enhance the flexibility in the lower limb and strengthen the digestive tract and organs. Third one is the Halasan. Halasan is one of the classic yoga exercise for curing the constipation, which helps to strengthen the back muscle, stimulate abdominal viscera, organ, and improve the digestion. Pranayam. Pranayam is essentially a breathing exercise that involves the abdominal muscle and belly movement and is known to improve the digestive system, improves the bowel movement with a pranayam, the best yoga pose for relieving the constipation. Next slide. Paschimottanasana, also known as the forward bend pose. It is one of the basic yoga mudra for relieving the constipation. Paschimottanasana treats the digestive disorders and constipation. This forward bending pose, the pressure within the abdominal cavity through rugs and the abdominal viscera, which in turn eases the symptoms associated with weak digestive and constipation. Pavan Muktasana, also which known as a gas releasing pose. Pavan Muktasana or wind relieving pose is one of the effective yoga to relieve the constipation and ease gas discomfort. Bhujangasana or cobra pose is one of the best yoga position for relieving the constipation and helps in treating the digestive issues, strengthening the abdominal muscle and clearing the digestive tract. Ardha Matsyendrasana. Ardha Matsyendrasana massages the abdominal organ and regulate digestive juice secretion. Ardha Matsyendrasana improves the bowel movement, is abdominal muscle and hence ensuring the proper food digestion. Shalabhasana. Shalabhasana or lotus pose assumes the posture of locust or grasshopper intends to build a body with a robust movement quality of locust. This asana helps treat constipation. It gives locust posture, massage and enhance the digestive system, thus treating the constipation. Balasana, it is one of the best yoga for relieving the constipation. Balasana contracts the organs, increase blood flow and help in bowel movement. Discussion. Yogasana can play a major role in prevention and condition as it initiates mobility of gastrointestinal tract and various muscle of abdomen which helps to pass the stool easily. As yoga also works on liver, pancreas, bile duct which produces digestive enzyme in proper amount so that the digestion of food become easier due to fiber rich diet along with the soft diet, consistency of formation of stool changes and soft stool forms due to which passing the stool become easier. Next please. Conclusion. Practicing yoga can keep gastrointestinal tract healthy along with yogasanas. Having proper dietary habits relieves constipation. If constipation get managed properly, then no other disease will occur. Thank you.
Thank you, Doctor.
Thank you, sir.
Next, I invite Dr. Sushma Shivpal for the paper presentation. Dr. Sushma Shivpal, are you there? Dr. Sushma Shivpal Handisod, are you there? Doctor, we can't hear your voice, doctor. Please unmute, doctor. No, Dr. Sushma, we can't hear your voice, doctor. Please reconnect your headset, doctor. We can't hear your voice.
Yes, sir. Yes, sir. Yes, sir. Yes, sir.
Okay, doctor.
Sir, can you hear me?
Yes, doctor. Please mute the another device on your place, doctor. Please mute another device, doctor. Another Zoom connected device, doctor.
Okay, sir. I unmute this other device. Can I start?
Please share the screen, doctor. I will share for you, doctor.
Yes, sir, please. Please, sir, share my PPT.
Okay, doctor. Just a second. Please start the session, doctor.
Okay, sir. My name is Dr. Shivshankar. I am second year PG scholar from Shalya department from Ashwin Rural Ayurvedic College, Sangamner. My topic is Agni Karma in surgical practice. Introduction. Shalya Tantra is one of the eminent branch of Ayurveda which is devoted to surgical specialty. It consists of many surgical procedures as well as parasurgical procedures like Shar Karma, Agni Karma and Rakta Mokshan, called as Anushastra Karmas. Agni Karma is superior among all of them and has proved to be a boon where local involvement of Vatas and Kapha doshas are observed in the disease. Next slide, please. Importance of Agni Karma. Acharya stated Agni Karma to be better than Shara Karma. Disease treated with proper Agni Karma has no chance of recurrence. Next, aim and objectives. To evaluate, elaborate, and discuss the various basic concepts of Agni Karma of Sushruta Next, Dahanopakaran. पिप्पलाज शकृत गोदंत शर शलाका अस्पक गतानाम जांबोष्टेतर लोहा मांस गतानाम क्षोद्र गुड़ स्नेहा सिरा स्नायु सक्त स्टी गतानाम त्वक विकार classification. Agni karma can be classified based on type of akruti, valay, bindu, vilekha, pratisaran explained by Acharya Shishrut. Next, Acharya Vagvat explained three more, Ardhachandra, Swastik, Ashtapat. Then next please. Based on Sthana, Tvaka Dagda, Masa Dagda. Next. Based on Dravya. Next. Snigdha Ruksha. Based on disease site, Sthanik Sthanantariya. Based on the disease. Next. In this is like Kadar, Arsha, etc., where Agni Karma is done after Chedan Karma. In fistula, sinus, Agni Karma done after Bhedan Karma, in surgical incision. In Krumidantha, Agni Karma after filling the cavity with good jagri, Madhuchista, Bivax, etc. Next, indication Agni Karma, pain aggravated by Vata in Tvacha Masa, Sira, Snayu, Sandhya, Asti. In chronic wound having some hard elevated tissues, cystic lesion, hemorrhoids, tumor, fistula, sinus, lymphadenopathy, filarious skin, tag, hernia, joints, disorders, and to stop bleeding from cut vessels. Contraindication of Agni Karma. Agni Karma can be done in all seasons of the year except in Sharad and Grishma. And in Pittaj and Raktaj Vyadhi. Patient with concealed bleeding, intestinal perforation by Acharya Charak, Brun of Snayu, Marma, Netra, Kushta, Brun, Vish and Shalya. Agni Karma should be properly done in 3 steps, in Purva, Pradhan and Pachat Karma. Next, Purva Karma. Next, please. In Purva Karma, a physician, after having carefully analyzed the seat of the disease and examining the individual for the strength, locations of the murmur, disease and season, should resort to Agni Karma. Pre-Agni Karma diet in all disease, Patient should be fed on a diet which is pitching. Next, please. Samyak Dagdha Lakshane. Next. Next. अनवगाढ़ व्रणता, तालफल वर्णता, सुसंसित व्रण, शब्द प्रादुर्भाव, दुर्गंधता, त्वक संकोच. Next. पश्चात कर्म. Next, please. Apply madhu ghruta, paste of chandan gairit with ghruta. Next, please. Mode of action. Agni karma and Ushna, Tishna, Sushma gun, which qualities against Vata and Kapha dosha, pacifies Vata and reduces Kapha, with Vedna Shaman, reduces pain. Next, please. Agni karma in various Shalyas Vyadhi, in Granthi, in Kapha Arbut, when only a small remnant of the tumor remains after the worms have eaten the area, should be scrapped and cauterized by Agni karma. In Upadhansha, the putrid portion of the penis should be excised and the remaining part should be completely cauterized with jambost shalaka made red hot by Agni. Ashma Nivran and other conditions. Agni karma is one among the Shashti Upakram when there is a bleeding in the basti. After removal of Ashmari, then Agni karma should be done for Rakta Stambhana. Next, please. In Chipa and Kunak, Agni karma in Ruddhi, Agni karma in Jatumani, Mashak and Tilkala. And Agni karma is hemostatic measures, means Rakta Stambhana Upay. Agni karma in Charma Kilantu Sanchidya Tahet Ksharena Chagninam. Agni karma in corn, in Kadar, the lesion should be excised and cauterized with heated oil. In Sushu Saita, Utprutya Dagdha, Desnehana Jeta Kadarsanyakam. In Bhagandar, Chaturvidhor Shansa Sadhanopaya, there are 4 Chikissa, Bheshaja, Kshara, Agni, and Shastra. In Arsha. Next slide. Current practice of Agni Karma. In current practice of Agni Karma, the Shalaka is modified with the heat source being electricity. The Shalaka has different shape for various specified use. This is used in various conditions like corn, warts, sentinel tag, etc. Next, please. Cauterization, modern concept. Electrocautery. Next, please. Electrocautery uses electrical current to heat a metal wire that is then applied to the target tissue in order to burn or coagulate the specific area of tissue. Electrosurgery. Uses of electrocautery to stop bleeding from small vessels to cut small tissues. In conclusion, Agni Karma therapy is result oriented to Vatach Kapha disorder due to Ushna Sushma Ashukari Gun. It specifies the Vata and Kapha dosha and removes Sotavru. No recurrence of the disease according to Acharya Shushruta. Tadagdhanam roganam punarbhavat. Basic chikitsa, shara chikitsa, and shastra chikitsa are unable to cure the disease, then Agni Karma can be used to treat the disease successfully. Challenges. Next, please. Patient consent, fear of scar formation post procedures, needs skilled physician to perform the procedure, burns due to performing procedures improperly. Thank you.
Thank you, Doctor.
Thank you, sir. Thank you, ma'am.
Next, I invite Dr. Umesh Kamlakar More for the poster presentation. Dr. Umesh, are you there? Hello, Dr. Umesh, are you there? Next, I invite Dr. Suraj for the paper presentation. Dr. Suraj Vani, are you there? Dr. Suraj, are you there? Okay, next I invite Dr. Jyoti Shidole for the poster presentation. Dr. Jyoti, are you there? Dr. Jyoti Shidole, are you there? Okay, next I invite Dr. Faisal Arif Khan for the poster presentation. Dr. Faisal Arif Khan, are you there? Dr. Faisal Arif Khan, are you there? Next I invite Dr. Sai Om Prakash for the paper presentation. Dr. Sai Om Prakash, are you there? Dr. Sai Om Prakash, are you there? Next I invite Dr. Reshma J for the paper presentation. Dr. Reshma, are you there? Dr. Reshma, are you there? Dr. Reshma, we can't hear your voice, doctor. Dr. Reshma, we can't hear your voice, doctor. Hello, Dr. Reshma. Hello, Dr. Reshma, can you hear me? Okay, Reshma has suffering from some network problem. Next, I invite Dr. Sneha Suresh for the paper presentation. Dr. Sneha Suresh, are you there?
Yes, sir.
Okay, doctor, please share the screen, doctor.
So can you please share my PPT?
Just a moment, doctor, I'll share for you. Doctor, please start the session.
Myself, Dr. Sneha Mari from Government Ayurved College, Nanded. Here I am presenting adulteration of drug. Adulteration is a practice of substituting original crude drug partially or wholly with other spurious substance, but the latter is either free from or inferior in chemical and therapeutic properties. In simple term, adulteration means debasement of an article. Next slide, sir. Adulterant. The adulterant must be some material which is both cheap and available in fairly large amount. Next slide, sir. Types of adulteration. First, deliberated adulteration, that means intentional, normally commercial with intention of enhancement of profit. And second one is accidental adulteration. Next slide, sir. Adulteration means deterioration, admixture, sophistication, substitution, inferiority, and spoilage. Deterioration means it is an impairment of quality or value of an article due to destruction or abstraction of valuable constituent. Next slide, sir. Admixture means is the addition of one article to another due to ignorance or carelessness or lack of knowledge. Second, sophistication is the intentional addition of spurious material with intent to do defraud. Next, substitution, inferiority. Substitution is the addition of an entirely different substance in place of original drug. Next slide, sir. Inferiority refers to any substandard drug which can be avoided by more careful selection of plant material. Spoilage, that means due to attack of microorganism which makes product unfit for consumption. Types of adulterants. Substitution with substandard commercial variety. Due to morphological resemblance to the authentic drug, different inferior commercial variety are used as adulterant. For example, Arabian Senna, Cassia angustifolia, and Dog Senna have been used to adulterant Senna. Next slide, sir. Substitution with superficially similar inferior drug. This inferior drug used may or may not have any chemical or therapeutic value as that of original natural drug. For example, belladonna leaves are substituted with ailanthus leaves. Next slide, sir. Substitution with artificially manufactured substance. To provide the general form and appearance of various drugs, some materials are artificially manufactured and are used as substituent of the original one. For example, artificial invert sugar used for honey. Next slide, sir. Substitution with exhausted drug. Here the same plant material is mixed which is having no medical components as they have been already extracted out. This practice is most common in case of volatile oil containing material like clove. Next slide, sir. Addition of synthetic principles. Sometime to fortify inferior natural products, synthetic principles are added. For example, adding citral to oil of lemon. Next slide, sir. Adulteration by addition of worthless heavy materials. A large mass of stone mixed with licorice root, piece of limestone are found in asafoetida. Next slide, sir. Use of vegetative matter from the same plant. This is done by mixing adventitious matter or naturally occurring with the drug in excessive amount or part of plant other than that which constitute the drug. For example, liverworts and epiphytes growing in bark portion are mixed with cascara or cinchona. Next slide, sir. Evaluation of drug. Evaluation, standardization of drug means identification, determination of quality, and determination of purity. Identification, by careful observational study of the collected drug, therefore drug from plant or animal identified by one, a qualified experience personally, or second, comparison with the authentic sample specimen. Next slide, sir. Quality, intrinsic value of the drug, that is the amount of medicinal principle or active constituent present. To maintain high quality product, one should do following things. One, select proper source. Second, appropriate time of collection. Third, collection of required parts of plant. Fourth, proper cleaning, drying of collected drug. And fifth, proper preservation to avoid contamination. Next slide, sir. So next slide. Purity. The purity of drug can be achieved by proper identification and second, quality assurance. Evaluation method. Evaluation of drug involves organoleptic, microscopic, biological, chemical, and physical methods. First, organoleptic evaluation of drug. Study of drug with the help of organ of sense. The microscopic characteristics of a drug may be divided into 7 headings: shape, size, color, fracture, and internal color, odor, taste, and texture. Next, sir, microscopic evaluation of drug. Evaluation of drug can be done in laboratory by using microscope and utilize various microscopic characters of the drug, such as type of arrangement of various cells and tissues. In microscopic evaluation, various parameters studied like stomatal number and index, palisade ratio, vein isolate number, size of starch grain, length of fibers. Palisade ratio, average number of palisade cells beneath each epidermal cell. Vein isolate number, number of vein isolate per square mm of the leaf surface midway between the midrib and the margin. Next slide, sir. Stomata number and index. Stomata number, number of stomata per square mm of epidermis of the leaf. Next slide, sir. Biological evaluation of drug, very useful in determining the pharmacological activity of drug. Since living organism or their isolated living tissues are used, this method is called the biological method or bioassay. Next slide. Physical evaluation of drug. The physical evaluation of crude drug is accomplished by the determination of various physical characteristics using various physicochemical techniques like specific gravity, melting point, and optical ratio. Rotation, sorry. Moisture content. Moisture content of a drug should be minimized to prevent decomposition of crude drug either due to chemical changes or microbial contamination. Next slide, sir. Viscosity. Viscosity of a liquid is a constant at a given temperature and is an index of its composition. Diffractive index, depending upon purity, it is a constant for a liquid and can be considered as one of the criteria for its standardization. Next slide, sir. Ash value. The residue remaining after incineration is the ash content of the drug, which simply represent inorganic salts naturally occurring in the drug as a form of adulteration. Extractive, water soluble extractive, alcohol soluble extractive, and ether soluble extractive. Volatile oil content, for example, clove contain not less than 15% volatile oil. Next, sir. Foreign organic matter. The part of the organ or other than those named in the description of the drug are defined as a foreign matter. Next, sir. Chromatography techniques. Chromatography represents a group of methods for separating molecular mixtures that depend on the differential affinities of the solute between two immiscible phases. Chromatography technique includes thin layer chromatography, high performance thin layer chromatography. Next slide, sir. It provides qualitative and semi-quantitative information of the resolved components. It enables the quantification of chemical constituent. Fingerprinting using HPLC and GLC is also carried out in specific cases. Next slide, sir. Thin layer chromatography include high performance thin layer chromatography, glass liquid chromatography, gel permeation chromatography, high performance liquid chromatography. Next, sir. Spectrometric method used for evaluation of drug, which includes UV radiation test for natural drugs, infrared spectroscopy, fluorescence analysis, mass spectrometry, X-ray diffraction, and radioimmunoassay. Next slide, sir. Drug evaluation as per Ayurveda, Charak Vimanstan 8 अध्याय explain idam eva prakriti evam gunam prabhavam asmin deshe जातम अस्मिन् कृतान् नैवं गृहीतम् एव निहितम् एवं उपस्कृतम् अनया च मात्राया युक्तिम् अस्मिन् व्याधे एव विविधस्य पुरुषस्य एतावन्तः दोषम् अपकर्ष उत्तुपशमयति वा यदन्य अपि च चैव विविध भेषजं भवेत् च अनेन विशेषण युक्तिमिति. Next slide, sir.
इदम एव प्रकृति। सर्वप्रथम औषध द्रव्य का नाम निश्चित करना चाहिए, साथ ही उसकी जाति या वर्ग का ज्ञान और विनिश्चय करना चाहिए। यह मतभेदों को दूर करने का प्रयत्न होता रहता है, अतः प्राथमिकता द्रव्य परिचय आइडेंटिफिकेशन ऑफ ड्रग को दी गई है। नेक्स्ट स्लाइड सर। एव गुणम फिजिकल एंड केमिकल प्रॉपर्टीज। द्रव्यों के गुणों की परीक्षा पंच ज्ञानेंद्रिय से की जाती है। इसके अतिरिक्त आजकल द्रव्यों का विश्लेषण करते हैं, उसके अंदर अल्कलॉइड्स, ग्लाइकोसाइड्स, सैपोनिन्स आदि का पृथक्करण करके उनकी रासायनिक संरचना का ज्ञान करते हैं। नेक्स्ट स्लाइड सर। एव प्रभावम थेरेपेटिक एक्शंस। अतः भेषज का दोष दुष्ट स्रोतस रोग तथा सेल्स पर क्या प्रभाव पड़ता है, यह अध्ययन किया जाता है। दैट इज फार्माकोडायनेमिक एक्शंस और कीमोथेरेपेटिक एक्शंस एंड फार्माकोथेरेपेटिक एक्शंस। नेक्स्ट स्लाइड सर। अस्मिन् देशे जातम हैबिटेट। जल, वायु एवं भूमि का प्रभाव वनस्पतियों पर भी बहुत पड़ता है। साधारण देश, अणुक देश और जंगल देश में उगने वाली वनस्पतियों की शक्ति में अंतर आता है, इसलिए अमुक कर्म के द्रव्य वहां से ही लेना चाहिए। यह चीज अच्छी ही ऐसा लौकिक व्यवहार भी बन गया है। नेक्स्ट स्लाइड सर। अस्मिन् ऋतो जातम सीजन इन विच इट ग्रोज। औषधि द्रव्य अपने प्राकृत ऋतु में ही उत्पन्न होकर उचित वीर्य वाली होती है, इसलिए ग्रंथों में उनका सुंदर वर्णन उपलब्ध होता है। नेक्स्ट स्लाइड सर। एव गृहीतम मेथड ऑफ कलेक्शन एंड एव निहितम मेथड्स ऑफ प्रिजर्वेशन। ऋतुओं में संग्रहित द्रव्यों की संग्रहण विधि भी शास्त्रों में वर्णित है। पूर्वाभिमंत्रित द्रव्य के आकलनार्थ। हाँ मैम।
You are exceeded the time limit. Speed up the presentation, doctor.
Okay, ma'am. Method of preservations and method of collection. Next slide. फार्मेको एव उपस्कृतम और अनयाच मात्रा युक्तम, मतलब फार्मास्यूटिकल्स and proper doses अस्मिन् व्याधो clinical trials and result. Next slide, sir. एव विविधस्य पुरुषस्य trial on healthy voluntaries and patients with the drug with due to regard of their temperaments and constitution. Next slide. Actions on a particular doshas. Next slide. Thank you.
Thank you, doctor. Thank you for the presentation. Next, I invite Dr. Reshma J for the paper presentation. Dr. Reshma, are you there?
Yes, doctor.
Okay, Dr. Reshma, I will share for you, doctor.
Okay.
Please start the session, doctor.
Good evening, everyone. I am Dr. Reshma J, first year PG scholar, Department of Agriculture. Next slide. So I am presenting the topic Amritagala Vishagala. Contents are introduction, types of Visha, sequential development of Agada, Vishavidya Jyotsniga, Amritagala Vishagala Sthanas, Arohana Avarohana of Kala, Suthagala Vishagala Kalas, conclusion and discussion. Next slide. So I am giving an introduction to Ayurveda. Ayurveda is considered as one of the ancient healthcare systems. So we all know that Ayurveda is based on the Panchabhaudika Siddhanta and Tridosha Siddhanta. All elements, every thing in the universe is made up of 5 elements, that is Prithvi, Tejas, Vayu and Akasham. Sharirika doshas are Vata, Pitta and Kapha, and Rajas and Tamas are the Manasika doshas. And one other important concept explained by Ayurveda is Loga Samhita Purusha, that is Loga Purusha Samya Vada. Human being is considered as the replica of the universe. That is Ayurveda. In Ayurveda, all other acharyas explains human being as the miniature representative of the universe. all the functions in the body is the reflection of the activities in the universe. So there, the Acharyas explained that there will be a similarity in each and every activities of an individual and the universe. Visarga adana vikshebehi soma surya anila yatha tharendi jagadeham kapha pitta anilastada. In Susruta Sutra Sthana, Acharya explains that Visarga adana viksheba functions are carried out by the Soma, Surya and Anila in the universe. Similar way, in the similar way, the Kapha, Pitta and Vada dosha carry out the functions of the body, similar functions in the body. That is Visarga, Adana, Viksheba functions in the body. Yavandaha Purusha, Tavandaha Loga Idi. That is, each and every phenomenon in the universe can be seen in the Purusha and vice versa. And I am explaining this concept here because in Amritagala, Vishagala, there is a similarity in the body of the individual as well as the change in the universe. Next slide. So introduction to Agada. Agada Tantra, as we know, is one of the Ashtangas of Ayurveda, dealing with Sarpa Keda Lutadi, Deshta Visha Chigilsa, as well as Vivita Visha Samyoga Chigilsa. It is called as Vishagara Vairotiga Prashamana by Charaga, Damstra Chigilsa by Vakpada, Vishatantra by Kashyaba. So the definition of Visha is derived from the word Vishada or Vishwaga, that is anything that create a dukkha or Vishada to the body. So we can say that not only poisons, all other diseases in a state that can hinder the life or the prana can be called as Visha. Next slide. So classification of Visha can be Akritrima and Akritrima Visha. Kritrima Visha is classified into Savisha Dravyakrita and Nirvisha Dravyakrita by Acharya Chakrapani. Akritrima Visha can be Stavara and Jangama Visha. Next slide. So sequential development of Agada Tantra. There are so many references of Visha available in Puranas and epics. Coming to Brihatrais, they have explained separate chapters. Sishruda Acharya contributed Kalpasthana for Visha Chigilsa. Arthashastra, Shonaga Samhita, etc. the unique works in this area. So there was a decline or deterioration in Visha Chigilsa after the invasion of foreigners and lack of revival from the physician who handled Visha Chigilsa. In Kerala, there was widely practiced Visha Chigilsa because of the geographical conditions in Kerala, as well as legendary tales known in Kerala. These all created a necessity for development of Visha Chigilsa in Kerala. So, as there is a wide practice of Visha Chigilsa in Kerala, several notable works were published from Kerala. Some of them are Kriya Kaumudi, Prayoga Samuchaya, Visha Vaidya Josniga, Visha Narayaniya, Kodashiri Marga, Visha Mahara Meghala, etc. Visha Josniga is one of the most popular and widely accepted one. Next, sir. Vishavaidya Josniga is one of the most accepted publications from Kerala. It is derived from the meaning of the word that which shines like a moon amidst the Visha Chigilsa literature. It has 21 Adhikaranas. 2 chapters are exclusively for Mantra Chigilsa. Some particular topics are explained in Vishavaidya Josniga are Thuda Lakshana, Utu Chigilsa, Tukudara, Pashu Chigilsa, and Amritagala Vishagala. Next slide. Amritagala Vishagala is a unique concept only explained in Vishavaidya Josniga. It is written in Malayalam language and it is explained in the 10 Adhikarana Sudha Kaladi Nirupana of Vishavaidya Josniga. Amritagala, Vishagala is also called Sudhagala or Chandragala. These are certain energy sports which are located on the body, power of which is equal to Amrit. That is, these kalas, Amritagala or Sudhagala, can hinder the effect of Visha. So these are explained in accordance with the Vriddhikshaya state of the moon that I have explained earlier, the connection between individual and the universe. So Amritakala climbs upwards or from the right side of the body of male and runs downwards in the left side. In females, it starts from the left side and runs downwards through the right side. Next slide. So these are the Amritakala sthanas. 15 points are there. These are the green points are the 15 points. Angushtam, Padugam, Sandhi, Janu, Bhukyam, Nabhi, Hridayam, Kujaha, Kandam, Nasa, Akshi, Karnam, Prur, Mathyam, Laladam, and Murthini. These are the Amritakala sthanas in the body. Next slide. So the change in position of Amritakala, Vishakala is explained in accordance with the changes seen in the moon during Shukla Paksha and Krishna Paksha. So Shukla Paksha, during Shukla Paksha, from the first day to the 15th day, the Amritakala climbs upwards from the first point to the 15th point, and during Krishna Paksha, it runs downwards from vertex to the Ankushta. Doctor, can you please play the video? There we can see the green one is Amritakala. When the Amritakala move upwards on each day, the Vishakala also move. That is, the Vishakala sthana will be in the 7th position of Amritakala. There is a gap between, a gap of 7 points between Amritakala and Vishakala. When the Vishakala is on Angushta, the Amritakala will be on the Hridaya. Always there will be a difference of 7 points between Amritakala and Vishakala. On the first 15 days, it moves upwards from the right side in the male, and next 15 days, it runs downwards on the left side of the male. In female, it is in vice versa. Here we can see that the Amritakala runs downwards and the Vishakala moves with the Amritakala. Next slide. So importance of Amritakala and Vishakala. When we do Vimardana of Amritakala, there will be stimulation of Amritakala, and the effect of Visha is reduced by Amritakala. That is, if a person comes with a bite on Amritakala, there will be good prognosis. That is, the Visha effect will be reduced due to the position of the bite at the site of Amritakala. But if the person comes with a bite at Vishakala, there will be bad prognosis because the ill effects of the Visha are increased due to the presence of Visha at the Vishakala site. So, with the help of Amritakala and Vishakala, we can easily do the prognosis of the condition. So another concept explained here is that if Vishakala is in Kantha, any food consumed is converted to Visha, even he thinks the food is Visha. When the Amritakala is in Kantha, and if the person remembers Amrit while taking food, it will act as Amrit to the body. So if a person eats food during Amritakala is in Kantha, the food will act like Amrit if he thinks the food is Amrit, and it will bring Pushti, Arogya, Bala, and Ayu without any Dukha, Palida, and Jwaradi Rogas. So another concept here says that if Amrita Kala is in Guhya Sthana, it acts as Vashya, and if Vimardana or Ekis or even staring at Sudha Kala or Amrita Kala at Guhya Sthana causes Vajigarana. Or again says that if we think prana at the middle of Sudhakala daily, it will bring Pushti, Sri Kanti and Sambat, Ojas, etc. And it also do Deharaksha. Next slide. So conclusion is that the prognosis of Visha or any other disease can be easily understood by Amritagala, Vishagala. Amritagala is thus the site where prana is located, and Vimardana of that site causes its stimulation, and thus any treatment given to that site will directly enter prana. That is, for example, if a person comes with a disease at Amritakala, and we apply medicine at that site, it can lead to an early good prognosis of the disease. In Agada Tantra, we can easily recover the patients by applying the medicines at Amritagala along with application at the site of bite. But if the bite is at the Vishagala site, there will be no chance of recovery, and there will be less effect for the medicinal treatment. Discussion. So this concept can be also discussed in other branches of Ayurveda also. That is, if a person in Kaya Chikitsa department comes with Sandhi Gadavada, then we can check the site of Amritagala at that particular day, and we can also apply some lepas or medicines at the site of Amritagala also. These medicines will directly enter the pranas. These are the sites of prana. So this medicine directly enters the prana and causes a very good prognosis of the disease. In such a way, all other Vajigarana Aushadas or other Netra Aushadas, everything can be given by watching the Amritagala, Vishagala on each day of the month. Thank you.
Thank you, Dr. Reshma. Thank you for the session. We have come up to the end of the session. Next, I would like to invite the final call of some participants. Dr. Sharon John, are you there? Dr. Sharon John, are you there? Dr. Tejasini Prakash Kharode, are you there? Dr. Tejasini Prakash Kharode, are you there? Final call of Dr. Umesh Kamlakar More, are you there? Dr. Umesh Kamlakar More, are you there? Dr. Suraj Bane, are you there? Dr. Suraj Bane, are you there? Dr. Jyoti Shidole, are you there? Dr. Jyoti Shidole, are you there? Final call of Dr. Faisal Arif Khan, are you there? Dr. Faisal Arif Khan, are you there? Dr. Sai Om Prakash Vakmare, are you there? Dr. Sai Om Prakash Vakmare, are you there? Okay, thank you. Thank you for all participants. I would like to invite Dr. Aishwarya Aras to conclude the session.
Thank you, Dr. Sabin. So it's an official end of Chatushtaya 2023. And on behalf of Team Ayurapta, I'm extremely grateful to our panel members for always being there. And next, I'd like to congratulate our participants for the active participation and the cooperation with us. Thank you all. We wish to soon meet you soon. Thank you all. Good night.